Okay, finally. Good morning, everyone. My name is Councillor Chris Moyes, and I am the Chair of the Board of Health. The Board Secretary has confirmed that we have quorum, so I'll call meeting 28 of the Board of Health to order. Today's meeting is being held by video conference and in person at City Hall in Council chambers. Because we are meeting in person and remotely, we ask everyone for their patience with any delays and technical issues, even though I showed no patience this morning so far. If you are registered to speak at today's meeting, please listen for me to call your name. I will call speakers in the order they appear on the list. The list of speakers can be viewed online by visiting the Board of Health page at toronto.ca/council and clicking the speakers box for today's meeting. The Board Secretary has provided all agenda materials on toronto.ca/council and via CMP, the Clerk's Meeting Portal. Directors, please ensure that your video is turned on. Please keep your mic muted unless you wish to question staff or to speak on an item. As part of each agenda item, I will ask directors to raise their hand or unmute their mic if they wish to question staff or to speak. I will then create a speakers list and will call on directors when it is their turn to speak. When voting on an item or a motion, I ask the directors ensure that they turn their video and to raise their hand to indicate their vote. Directors, I want to remind you that you must submit and approve your motion by email. Staff are available at boh@toronto.ca to help with motions. The Board of Health acknowledges the land we are meeting on is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. The City of Toronto acknowledges all treaty peoples, including those who came here as settlers, as migrants either in this generation or in generations past, and those of us who came here involuntarily, particularly those of us brought to these lands as a result of the transatlantic slave trade and slavery. We pay tribute to those ancestors of African origin and descent. Are there any declarations of interest under the Municipal Conflict of Interest Act? If you have an interest, please raise your hand or unmute your mic and indicate the item number and the nature of the interest. Seeing none. Next, we need a motion to confirm the minutes from our last board meeting on September 15th, 2025. Director Chandrabalan. All those in favor? Opposed? Carried. So again, good morning to everybody. The Jays are playing tonight. I'm excited to jump into our meeting today as we have a number of timely and informative items to get through. With the school year underway, the team at the TPH will be presenting on the many ways we collaborate with the school boards to promote student health and well-being. You may be familiar with the student nutrition program and immunization efforts, but the work TPH undertakes in our schools includes several other initiatives. I'm looking forward to learning about this important work to support children and youth across the City of Toronto. I would like to welcome Clayton Latouche and Brendan Brown, the Directors of Education for the Toronto District School Board, the Toronto District Catholic District School Board, who have joined our staff for the presentation today. And they're sitting to my left. Raise your hand. There we go. As the respiratory illness season begins, the TPH team has always prepared some updates that highlight our work to prevent the spread of RSV, respiratory syncytial virus. I'm very happy to see that as of this year, all adults over the age of 75 can receive a free RSV vaccine from their healthcare provider. I hope that we can all do our part to keep each other well this winter by spreading the word about this new program to friends and family who are eligible. Looking ahead to the new year, the TPH will be launching a new web page on January 1st, which will display the results of the annual inspections we conduct at childcare centers across our city. Similar to other TPH inspection and disclosure platforms like DineSafe, Body Safe and Swim Safe, the website will include routine inspections, complaint investigations, and re-inspections with searchable listings and maps-based results. I'm glad that parents and caregivers will now have access to this crucial health information as they select a child care center. And finally, we will get a glimpse into all of the planning that is taking place ahead of next year's FIFA World Cup events. TPH is working closely with the city's FIFA World Cup 2026 Secretariat and city divisional partners to embed public health considerations into all aspects of events planning and response. From potential foodborne illnesses, outbreaks to extreme environmental conditions, TPH will ensure we are prepared for anything that could happen with an influx of visitors to our city. And with that, I'm going to turn it over to Dr. Murdy to share some remarks.
Thank you, Chair Moyes. Good morning, and welcome to our October Board of Health meeting. Thank you to everyone for the warm welcome and support during these first couple months in my role as Toronto's Medical Officer of Health. I've met so many wonderful people across the city who have been very generous with their time and ideas on how we can put health promotion at the forefront of our work. These conversations and connections have been informative and encouraging as we look ahead to today's agenda items, which align with the ongoing implementation of Toronto Public Health's 2024 to 2028 strategic plan. At today's meeting, we are bringing forward 4 items that either directly relate to the strategic plan initiatives or to provincial requirements or community health protection. Our school health report is related to our strategic priority on promoting health and well-being across the lifespan and demonstrates the various ways we work with school communities to improve the health of children and youth. I would also like to acknowledge our school board partners at the Toronto District School Board and Toronto Catholic District School Board, Conseil Scolaire Viamonte and Conseil Scolaire Mon Avenir, and their directors of education for their encouragement and engagement with our public health programs to support student health and well-being. And would also like to thank Directors Clayton Latouche, Director of Education at TDSB, and Dr. Brendan Brown, Director of Education at TCDSB, for joining us here today. The close relationship we maintain with our school board partners demonstrates our joint resolve to meet our provincial mandate as we look to renew our Toronto Healthy School Strategy for 2027. Our important work supporting school-aged children is an ongoing effort throughout the school year. Toronto Public Health remains focused on keeping students and school communities healthy. This includes promoting healthy eating and improving access to nutritious food through the city's student nutrition program. By the end of Phase 2, the program expansion, 685 school communities, or 81% of Toronto Public Schools, will be operating a student nutrition program. Our student immunization programs are also ramping up as we aim to reduce infectious disease spread and get students caught up on their vaccinations. As of this summer, approximately 60,000 Toronto students in grades 2 to 5 were not up to date with their records. Students in these grades will begin to receive letters from Toronto Public Health later this year, in addition to the citywide health promotion campaign emphasizing the importance of immunization against vaccine-preventable diseases. With measles and other vaccine-preventable diseases circulating in Toronto, this work is critical to keeping our school populations and broader communities safer. In addition to our work in schools, in January 2026, we are launching a new online public disclosure program for infection prevention and control inspections in Toronto childcare centres. Toronto Public Health has been inspecting childcare centres for more than 20 years and working with operators towards improving their infection prevention measures. Making these inspection results publicly available fulfills a provincial requirement under the Ontario Public Health Standards. But more importantly, it shows our commitment to transparency and accountability to the people of Toronto by helping parents make informed decisions regarding services and the potential impacts to their child's health. As we get ready to launch the new program, we will be supporting childcare center operators with new e-learning resources and information sessions. With fall now in full force, we know that COVID-19, influenza, and respiratory syncytial virus, or RSV, will be rising over the coming months. Our integrated respiratory disease dashboard has been refreshed for the 2025-26 respiratory illness season with information on these 3 illnesses, and is one of the important ways that we provide weekly information to the public and our healthcare partners on what is happening in the city. As of today, COVID-19 and flu vaccines are available for the general public across the city at participating pharmacies and primary care offices. I encourage everyone 6 months of age and older to get their COVID-19 and flu vaccines conveniently at the same time. We are also pleased to announce that RSV vaccines are available this year to adults 75 years of age and older. This vaccine can be received at the same time as the COVID and flu vaccines for eligible residents and is available through primary care offices as well as through 2 TPH-run clinics. We encourage everyone to get their vaccines so they can protect themselves and the wider community from getting ill this respiratory season. And today, being Game 3 of the World Series, I know a lot of Toronto sports fans are focused on the here and now, cheering on the Blue Jays. Mass sporting events like these are topics Toronto Public Health thinks about regularly. We are currently preparing for the next FIFA World Cup in 2026, with 6 games scheduled to be played in Toronto next June and July. Any mass sporting event like this takes years of planning and continued collaboration across multiple city divisions and external partners. We are working with our partners to fulfill our role to protect the population's health, prevent illness, and be ready for any health-related incidents, from outbreaks to extreme weather events during the games and fan activities. These preparations for FIFA World Cup also tie into our strategic plan priorities, particularly the focus on emergency preparedness and response through a public health lens. The 4 reports brought forward to the Board of Health today demonstrate the range of programs, services, and initiatives delivered by Toronto Public Health and our dedicated staff. This is where public health shines and shows its value, protecting our residents, promoting health opportunities, providing value and transparency to Torontonians, and collaborating and engaging with our partners. I look forward to championing this work and moving these projects forward over the months and years ahead. I'll turn it back down to the chair.
Thank you, Dr. Murdy. As Dr. Murdy mentioned, we have 4 items on today's agenda to review. I do have a new business item, but I will add that later. The first item is HL 28.1, working with schools to improve the health and well-being of children and youth. There is a presentation on that item, so I'll hold it down in my name. Item number 2, HL 28.2, publication of Child Care Center infection control inspection results. There's also a presentation on this item, so I'll hold it down. Item HL 20.3, Toronto Public Health update on respiratory syncytial virus, RSV prevention. There's also a presentation here, so I will hold it down. And item HL 20.4, Toronto Public Health preparation for FIFA World Cup 2026, and there are speakers on that one item, so I'll hold it down as well. Okay, I'll add my new business later. So the first item held is HL 20.1, working with schools to improve the health and well-being of children and youth. We will begin with the presentation on this item. We will then take any questions from the board for our guests before hearing from any registered public speakers, and then moving it back to the board. Again, our speakers do have to leave early, so this is why we're having members ask questions first. So I will ask Dr. Murdy to introduce our guest speakers and speakers on this item.
Thank you so much. Today we have Joanne Vigliano-Scott, our Director of Community Health and Wellbeing, and Dr. Allison Chris presenting on school health.
Good morning. Today we're presenting the report, Working with Schools to Improve the Health and Wellbeing of Children and Youth. Next slide, please. This report provides an overview of the health services TPH provides to schools to promote and protect the health and well-being of school-aged children and youth. It outlines how programming aligns with provincial priorities and describes key partnerships driving this work. And I'm so pleased that we will also hear from our 2 school board partners later in this presentation. Next slide, please. This slide provides an overview of the key policies and evidence-informed practices that guide school health promotion services. School health services are informed by population health and surveillance data. Key priorities are determined by reviewing current evidence and data on the health status of children and youth and consulting with public school board partners. The most recent data shows that mental health indicators such as self-reported fair or poor mental health have worsened from 2019 to 2023 among grades 7 to 12 youth. In 2023, the Ontario Student Drug Use and Health Survey found that only 23.5% of GTA students in grades 7 to 12 met the recommended daily physical activity guideline during the past 7 days. And school vaccine coverage rates continue to increase, but are lower than those before the pandemic. In addition to monitoring and sharing data, Toronto Public Health delivers programs and services in accordance with the Ontario Public Health Standards. School health guidelines set the foundation for school public health programs. It mandates our work with local school boards and directs the development of public health programs to improve the health of school-age children and youth. We are anticipating new direction for schools to be implementing in the 2026-2027 school year. Key approaches outlined in the Ontario Public Health Standards, such as the Foundations for a Healthy School Framework and Proportionate Universalism, guide the implementation of key priorities. The framework embeds health promotion into all aspects of school life. The image on the right shows the 5 components of the Healthy School Framework. Toronto Public Health School Services work to address the 5 components found in this framework. The principle of proportionate universalism is also applied to school health service delivery, providing universal health services to all schools while offering more intensive, tailored services to those schools with higher needs to reduce barriers and promote equity. Together, these approaches create healthy school environments that positively impact students' health and well-being, including their physical, mental, social, and emotional health. Next slide. The Toronto Healthy School Strategy is an example of our collaboration with and partnership with Toronto school boards. The strategy is an agreement between Toronto Public Health and the 4 publicly funded school boards in Toronto: Toronto District School Board, Toronto Catholic District School Board, Conseil Scolaire Viamonde, and Conseil Scolaire Catholique Mon Avenir. This strategy formalizes the commitment of all partners to engage in collective action to support student well-being through the creation of healthy school environments for children and youth. Its goals are to strengthen the partnership between Toronto Public Health and the school boards, establish a work plan with shared goals, share data and communicate on joint initiatives, and conduct further research on the health of students. Examples of some key activities that advance the strategy include our regular meetings with senior leadership from both TPH and the school boards, the development of formal agreements that enabled significant expansion of the Into Kids Health program in the last year, and the collaborative approach related to addressing pandemic-related immunization gaps and strengthening infectious disease prevention through assessments. Our partnership with the school board is integral to advancing health outcomes of students and youth, and we are grateful for the collaborative spirit, the expertise that our partners bring to the partnership, and for ongoing commitment towards the goals of the strategy to improve health outcomes for children and youth. Next slide, please.
It is through collaboration and partnership that we advance our goal of achieving optimal health of school-age children and youth. Toronto Public Health collaborates with provincial school system partners, such as the Ministry of Education, to create healthy school environments by contributing towards the implementation of the Ministry of Education's policy program memorandums, or PPMs, in school across a range of issues, such as vaping and physical activity. TPH also participates in provincial tables, such as the Council of Ontario Directors of Education and the Council of Ontario Medical Officers of Health, or CODE-COMO, which facilitates communication and collaboration between education and public health to advance shared objectives and develop innovative solutions to issues affecting children and youth. Locally, Toronto Public Health works with other city divisions to advance shared priorities related to children and youth. For example, TPH contributes to the implementation of citywide strategies, such as Social Development's SAFE-TO, a community safety and well-being plan. School public health nurses participate in integrated safety coordination teams, which are multi-sector teams comprised of frontline staff from various institutions who collaborate to assess and mitigate the risks and impacts of violence in select neighborhoods in Toronto. Next slide, please. I will now speak to the range of services that Toronto Public Health provides in schools. We provide services to over 350,000 students in the City of Toronto from across 4 public school boards at over 800 schools. This includes approximately 390 schools that receive more intensive services. School board indices are used to identify the level of need of a particular school community and prioritize resource allocation based on factors such as income, language, and local population. There are approximately 85 school public health nurses that connect schools to TPH, city, and community services. School public health nurses act as a critical link to Toronto Public Health in schools to facilitate effective coordination and collaboration. In addition to the school health team, school health services are delivered by multiple programs across Toronto Public Health. They address a range of topics such as mental health, infectious disease prevention, nutrition, physical activity, substance use prevention, sexual health, dental, and vaccine preventable diseases. Next slide. The work supporting school students begins before school start. School readiness programs help children and families prepare for a healthy and successful transition to school. Through communications and parent engagement activities, Toronto Public Health provides health promotion resources and information about key topics such as disease prevention, immunization, stress, sleep, physical activity, nutrition, dental and oral care, speech and language, and vision health. An example is a Healthy Start to School communication tool, which provides information and strategies and tips for parents, caregivers, guardians to help their child have a healthy start to school transition. Toronto Public Health promotes vision health and comprehensive eye exams through universal and targeted approaches to raise parent and caregiver awareness about early identification of vision issues, help families navigate vision services and school board initiatives, and promote the OHIP-covered comprehensive eye exams for anyone 19 years of age and under. These include general communications to all parents with kindergarten readiness letters, back-to-school letters, as well as targeted communications with specific schools where Toronto Public Health attends kindergarten readiness events to promote these key messages. Next slide. The next few slides go over some of the services that Toronto Public Health provides in collaboration in schools. Toronto Public Health's dental and oral services provide dental screenings in schools aimed to promote oral health and well-being. Toronto Public Health also provide education on oral health and help to connect families with appropriate resources, such as the Healthy Smiles Ontario program. In the 2024-25 school year, Toronto Public Health screened over 174,000 students. Of the students screened, about 46,000 children identified as requiring preventative care, and 25,000 children were identified with tooth decay and referred on for treatment. Of those referred for treatment, about 8,000 require urgent dental care, such as large cavities, pain, swelling, abscesses, and 17,000 required non-urgent dental care. Next slide. Toronto Public Health is required to implement and enforce Ontario's Immunization of School Pupils Act, which requires students who attend elementary and secondary school to be vaccinated against 9 specific diseases. Toronto Public Health uses a multifaceted approach to facilitate high vaccination rates among elementary and secondary school students and prevent vaccine-preventable disease outbreaks in schools. This involves providing education, resources, and information about the Immunization of School Pupils Act through citywide public education and outreach efforts. It also involves assessing and maintaining immunization records and/or exemptions for students attending school in Toronto. Toronto Public Health also delivers this school immunization program, which administers 3 vaccines to students in grade 7, including HPV, hepatitis B, and meningococcal. In the 2024-25 school year, Toronto Public Health held 879 school clinics at 435 schools, vaccinating a total of 20,893 students in middle school. To prevent disease, Toronto Public Health works with schools to complete outbreak investigations and implement appropriate control measures to minimize and stop the spread of disease outbreaks in school. To supplement this, TPH also shares information and resources to reduce the spread of respiratory infection and works directly with schools to promote these resources within their school communities. Next slide.
School liaison public health nurses work with schools to provide health information to promote physical activity through curriculum and student engagement initiatives such as playground activity leaders in schools. PALS provides opportunities to help foster a sense of belonging and inclusion among students while engaging them in physical activity in the schoolyard. Toronto Public Health also collaborates with Green Communities Canada on the School Travel Planning Initiative, which encourages active and sustainable travel, either through walking, cycling to school, and improved road safety. Toronto Public Health is working in collaboration with the City Manager's Office to support the phased expansion and implementation of a universal morning meal program. Through Toronto Public Health, the City of Toronto provides funding to school communities via foundation partners to assist with the delivery of healthy meals or snacks, with Toronto Public Health overseeing the grant application and review process. This fall, it's expected that 685 school communities, or 81% of Toronto's public schools, will operate a student nutrition program. In addition to operational support, Toronto Public Health provides nutrition consultation and menu planning services to support programs to follow the Ontario Student Nutrition Program nutrition guidelines. TPH also promotes healthy eating in with children and youth and their adult influencers through food literacy activities that help students make healthier food choices. Next slide, please. The Into Kids Health Program is a collaborative initiative between Toronto Public Health and school communities to foster physical activity, healthy eating, community connections, and positive mental health. Toronto Public Health staff play a collaborative role with school staff to develop school action plans that address multiple health behaviors and topics. Together, Toronto Public Health and schools implement actions to engage staff and students while building capacity and leadership, promoting health education through curriculum resources, and establishing community partnerships that promote health. The program improves social and physical environments within schools, and some examples include the purchasing of resources such as garden tools, playground equipment, and cooking supplies to promote physical and food literacy, creating welcoming spaces like chill zones and clubs that support inclusivity and emotional well-being, and organizing community building events such as wellness days to foster a sense of belonging and strengthen school communities. This slide brings the heart of our work to life with real stories and testimonials from the people impacted by our programs. Next slide, please. Toronto Public Health delivers a wide range of services and programs to students to prevent sexually transmitted and bloodborne infections, unintended pregnancies, and promote healthy sexuality throughout the lifespan. Toronto Public Health provides tailored workshops on sexual health topics such as consent and communication, positive relationships, healthy growth and development, reproductive health, gender identity, sexual orientation, and healthy sexuality. Toronto Public Health also indirectly supports students through increasing awareness, education, and capacity building amongst parents, guardians, educators, and service providers who work with students. Key activities consist of outreach, education, and consultation services, the delivery of tailored workshops, social marketing and communication campaigns, and resource development and distribution. Next slide, please. As previously reported in 2023, mental health and substance use have been identified as challenges for school-aged children and youth in recent years, particularly following the COVID-19 pandemic. Toronto Public Health promotes mental health and prevents substance use harms by helping students implement programs or activities that develop protective factors such as a positive school climate, healthy coping strategies, a strong sense of belonging, and positive self-esteem. A key component is engaging students through various youth leadership initiatives, which are student-led and promote belonging and well-being. This approach aligns with the Toronto School Board's mental health strategies and action plans and provides further opportunities to collaborate with school board mental health leads or school support service workers. One example is that Toronto Public Health continues to implement the Healthy Relationships Plus program with grade 7s and 8 students, which equips students with skills to manage emotions, cope with stress, build positive relationships, and thrive academically, increasing positive mental health and decreasing dating and peer violence. Since the program launched in 2023-2024 school, we've reached a total of 600 grade 7 and 8 students, and we will be expanding to include 19 additional TDSB schools in the 2025-2026 school year. Toronto Public Health also works with school staff, administration, parents, guardians, and youth to prevent and reduce harms related to substance use, including alcohol, cannabis, vaping, and tobacco. Prevention efforts focus on education about the risks and harms of substance use to help students make healthier choices. These efforts include online tools and resources such as the Safer Partying Toolkit, a vaping hub with accessible and culturally responsive resources, and programming on vaping prevention and cessation, school-based education, youth leadership programming, and public awareness campaigns about the health risks associated with substance use.
Next slide, please. Toronto Public Health enforces the food premise regulation and conducts food safety inspections of cafeterias, student nutrition programs, and other food premises located in all publicly funded and independent schools to maintain safe food handling and to prevent foodborne illness outbreaks. Toronto Public Health also enforces the Ontario Regulation 565 for public pools and conducts compliance inspections of public swimming pools and recreational water facilities in schools to maintain healthy recreational water facilities. Toronto Public Health enforces the Smoke-Free Ontario Act and conducts annual compliance inspections at each secondary school. Coupled with substance use health promotion activities, these efforts work to reduce the use and deter uptake of vaping and smoking. Next slide.
As we have seen today, Toronto Public Health implements a large number of services in schools to protect and promote health, utilizing a multifaceted approach to deliver school health services with partners to improve health outcomes. Toronto Public Health will continue to work with public school boards and system partners to create healthy school environments that promote the overall health and well-being of students, including physical, mental, emotional, and social well-being. To achieve this goal, Toronto Public Health will closely monitor the health status and outcomes of school-aged children and youth to inform program planning, respond to emerging issues, and strengthen impact through collaboration with schools. A key priority for 2026 will be the continued implementation of the goals of the Toronto Healthy School Strategy with our partner as it enters its final year. As we work to further enhance the health of children and youth in Toronto, we are bringing forth a recommendation for consideration by the board to initiate the development of the next Toronto Healthy School Strategy to launch in 2027. Next slide, please. Finally, as we shared today, collaboration is essential to effectively delivering school health services and improving the health of school-aged children and youth. I want to take a moment to thank all of our partners, internal and external, for your ongoing collaboration on building healthy schools and communities. A special thank you to our school health teams here at Toronto Public Health and all the teams providing school health services. Thank you for all you do each and every day. Improving the health of children and youth is a complex, and one organization cannot do it alone. A special thank you to our school board partners for the shared commitment towards health and learning. Our collaboration continues to create inclusive and supportive environments where children and youth can thrive. With that, I would like to welcome the Director of Education for TDSB, Clayton Latouche, and Director of Education for Toronto Catholic District School Board, Dr. Brendan Brown, to share some remarks.
Good morning, everyone. Thank you, Chair Moyes. It's good to see you, as always, members of the Toronto Board of Health. I also want to extend a heartfelt congratulations and welcome to Dr. Michelle Murray, Toronto's new Medical Officer of Health. Dr. Murray, your leadership and public health expertise is deeply valued within the education community. We look forward to continuing our strong partnership to advance the health and well-being of all students within all of our families across the city. So it's also a pleasure to be here today with my colleague, Clayton Latouche, with the Toronto District Board, as well as our partners from Toronto Public Health. The Toronto Catholic District School Board continues to be very proud to support the renewal of the public health strategy because it speaks directly to the core of our work. Our work is in education, and we want to make sure that we are creating the conditions in our schools for all students to be healthy so that they have the best opportunity to learn. Students can only really learn if they are healthy and thrive when their environments nurture both the body and the mind, which speaks to a lot of our work together. Over the past several years, we've faced extraordinary challenges, including a global pandemic. And thanks to that strong collaboration that we have with Toronto Public Health, we've come out stronger. We got to know each other intimately with our weekly meetings with Toronto Public Health. Great to see our friends that we've been working with online in person now, but it was our partnership that really brought us through that pandemic and strengthens the work that we do today. So I want to talk about 4 key ideas from the perspective of Toronto Catholic, And the first message really is that power of partnership. Health and education go intimately hand in hand. So at the heart of education is making sure that every student feels loved, feels cared for, and feels safe in our schools. And feeling loved and feeling that care means creating environments that foster belonging and trust, where students know that there are caring adults that they can go to in times of need. And these safe and welcoming spaces are also essential to positive mental health, to inclusion, and as I said, as an academic organization, they're important for academic success. So our partnership with Toronto Public Health through the Toronto Healthy Schools strategies is how we make that possible. So it's our shared commitment to creating these shared school environments where health and learning work in partnership, go hand in hand. And this goes across all of the Toronto school boards. It's really allowed us to align data, our priorities, and supports that directly influence students. And we see the impact. We see better attendance, greater confidence. We see stronger resilience and that sense of belonging in our schools as a result of that partnership. We often think about the idea that more support leads to better outcomes for students. In a lot of ways that is true. But a lot of the work that we do also is about fostering independence. Really, that's what the partnership achieves for our students, because a lot of the work that we do is knowledge-based and helps to empower our students with the habits, with the knowledge, but that true, so that they can care for themselves and so that they can care for others. So I'm pleased to see this report before you today, and I support its recommendations to continue this collaboration and begin developing the next Toronto Healthy Schools strategy for 2027. It was amazing seeing the strategy that was the 2022 to 2026 with my signature on there, and I can't believe we're at the spot again when we're looking at developing the new plan moving forward. The second key message is really about the impact of our work, and we heard a little bit about it in the presentation today, but a healthy start to every school day. So a successful day of learning begins with nourishment. No child should start any day hungry. So through the Student Nutrition Program, it's championed by Mayor Chow, Toronto Public Health, and in Toronto Catholic, the Angel Foundation for Learning. Over 66,000 students across 174 schools throughout Toronto Catholic receive healthy snacks and healthy meals every day. This year, we've brought 7 new schools on board. They've joined the program, ensuring even more students benefit. And the students, these programs do more than feed students. They level the playing field. They enhance focus, and they teach lifelong healthy habits to students so that when they feel full, they're in a better position to learn. So as City Council advances its strategy for universal morning meal program by 2026-27, this partnership will remain essential to ensuring that every child starts their day ready to learn. Third key message I wanted to talk about today is ongoing with the impact of our work, but keeping students healthy and protected. So our collaboration with Toronto Public Health extends beyond the classroom. It's about prevention, it's about protection, and it's about care. From immunization and infection prevention to dental and oral health, we work together to keep students safe, healthy, and when we do that, they're in a better position to learn. So as an example, through the dental and oral health program, almost 45,000 students in the Toronto Catholic District School Board were screened just last year. And now the 45,000 is a big number, but each individual one represents a student who can smile, who can focus, who can learn without pain or interruption. Those things that might impact their learning really contributes to the ways in which they can focus in class. And beyond those big numbers and incredible results, our public health nurses, our hygienists, inspectors, our educators all work closely hand in hand with our guidance counselors, their social workers, and our psychologists in our schools, because we realize that together we need to help to ensure that a student knows where to find the help when they need it. My fourth key message today is about supporting student mental health and well-being, because we know that students learn best when they feel emotionally safe and feel supported. So the Into Kids Health initiative is one of the many ways in which this partnership builds those conditions. So it's just a quick example, but in 24 of our schools in the Toronto Catholic District School Board, We've got TPH staff working directly with almost 7,000 students, helping to promote mental health, helping to promote wellness and student engagement. And the work that they're doing is helping to build resilience, it's helping to build confidence, healthy coping skills. We also want to be doing so intentionally to be reducing risks like isolation and risks like substance abuse that go with that. So together we're creating those safe schools where schools are not just places of learning, but places of belonging, places of healing, and places of hope. So at the Toronto Catholic District School Board, public health is intimately woven into the fabric of education. It really is how we help students learn and grow. Students do well if they can. Students do well if they have the conditions and they have the supports that are in place to thrive. And our goal with our partnership is to help to make that happen. So the nurses, the health educators who walk our halls in Toronto Catholic every day, they really are, they are extended family. They work together and their care helps to make learning possible. So none of this would be possible without the dedication of Toronto Public Health, the City of Toronto, and our colleagues in the TDSB, Mon Avenir, and Viamonde. So on behalf of the Toronto Catholic District School Board students, families, I'd like to say thank you for your partnership, for your leadership, and for your shared commitment to Toronto's vision, because together we are building schools and a city where we are thoughtful about every student being healthy, supported, and truly loved. Thanks so much for the opportunity.
Thank you, Dr. Brown, and I'm really pleased to be here as well to contribute to this really important conversation, representing the Toronto District School Board as the recently appointed Director of Education. And I can say that it was quite reassuring to be able to step into an established partnership and to be able to continue the joint work that Brendan spoke so eloquently about. So it's a pleasure to be here this morning, and on behalf of the students, families, and staff of the TDSB, I want to thank Toronto Public Health. Dr. Murthy, welcome to the role, and we certainly look forward to continuing our joint partnership. The school boards and public health contribute together to supporting the well-being of our students, and that is so important in order to set the foundation for effective learning. So we know that students are supported with healthy food, safe environments, and mental health resources. And when those things are in place, they're more likely to achieve and to thrive. School health services support physical, social, emotional, and mental health by contributing to a positive school climate. A positive school climate that is safe, inclusive, and accepting of all members of the community, students, so that they can reach their full potential. The connections are clear. Healthy students have improved attendance, academic achievement, resilience, confidence, mental health, self-esteem, sleep quality, and reduced depression. Working together, we collaborate to support the well-being of children and youth through joint strategic planning, collaboration, data sharing, and evaluation. This includes targeting all areas of a comprehensive health strategy that include nutrition, physical activity, dental and oral care, and infectious disease prevention. But it also includes mental health, substance use prevention, sexual health, and understanding racism and violence as a public health issue. Together, our organizations work together to support the holistic development of students across our large city. This shared work is strengthened through the Toronto Healthy School Strategy. Principles such as equity, student voice, and collaboration with families and communities are central to both the strategy and to our daily work. They remind us that healthy promotion in schools is fundamentally about creating inclusive and supportive environments where all children and youth can achieve and thrive. Shared data and joint planning help us understand emerging needs, track outcomes, and ensure that resources are directed where they are needed most. This is especially important in a city as large and as diverse as our great city of Toronto. We see where student outcomes have improved as a result of the Healthy School Strategy, and I'll share some examples. Student nutrition programs benefit children across all socioeconomic backgrounds, promote equity, enhance nutrition knowledge, and contribute to healthier, lifelong habits. In 2024-25, we reached over 165,000 students. Through the program, Toronto Public Health staff create a comprehensive school community assessment, form and fund action plans, and create connections with local partners. Infectious disease prevention initiatives have focused on strengthening vaccination rates for the 9 diseases identified under provincial legislation. An assessment of TDSB students born in 2008 was carried out in 24-25 school year, and vaccine coverage for the Immunization for School Pupils Act vaccines went from, get this, 23% at the start of the assessment process to approximately 86% by the end of the process. That is the result of strong partnership. A similar assessment of TDSB students born in 2016 happened in the 2023-24 school year and was completed last fall, and vaccine coverage similarly went from 26% at the start of the assessment process to approximately 89% at the end of the process. Toronto Public Health carries out annual dental screenings in elementary schools to identify emergency, essential, and preventative dental needs, and over 126,000 students have been seen. As we look ahead, our call to action is to continue building on this strong foundation. This means ensuring the needs of our most underserved communities are met and continuing to listen to the voices of students and their families. We know that health challenges of our young people are complex and interconnected, and that is why it's so important for us to work in interconnected ways as organizations together. By working together, we have done what we have accomplished through this strategy, and our day-to-day partnerships is truly laudable, and we look forward to continuing the strong partnership to serve all of our students across our city. Thank you.
Thank you, Director Brown and Director Latouche. Thank you for being here today. As I've mentioned in my preamble, we're going to ask questions of the directors first because they do have to leave. Who would like to ask a question of the director? Can staff change my screen? Because I can't see all the directors on my screen. While that's being okay, Councillor Chang, go ahead. 5 minutes.
Thank you, through the chair. Thank you for your ongoing collaboration with the school boards and Toronto Public Health. I think it's so important. My first question is with regard to data. As you know, data is so important for us to make informed policy decisions. And I'm just wondering what kind of data sharing currently exists between the school boards and the Board of Health and the Toronto Public Health, and how can we strengthen that data sharing?
Thank you, and through the chair, we know how important, as you pointed out, data is to be able to make informed decisions, to make sure that resources are targeted where they're needed most and are likely to have the greatest impact. And so having a data sharing agreement is really important. Such agreement is established through our partnership through SafeTO and is an important element in the Healthy Schools strategy. And we look forward to the opportunity to engage further with Toronto Public Health in looking to establish an effective data sharing agreement going forward to again make sure that our all of our school communities are well served, and every student is well served in that process. So we look forward to exploring opportunities to deepen the partnership when it comes to strengthening the way that we access data, share data, and utilize data.
Great. I'm very grateful to hear that. I know that the school conducts a school climate survey, which is an important touch point for schools to understand how their students are doing. And I wonder, would there be an opportunity for Board of Health or Toronto Public Health to speak into that, to perhaps identify some opportunities in what kind of data is collected in that survey?
Through the chair, the school climate survey that is conducted in our schools across the province and including our school boards here in the city is governed by provincial direction through the Ministry of Education. And so the survey is formulated within those guidelines. There is the opportunity for us locally to formulate questions that speak to our local context. And so through our partnership with Toronto Public Health, we can certainly engage in those conversations to see how we can align our efforts to ensure that the data that is collected is going to serve, again, all of our students well through our joint partnerships that we have established across school boards and with Toronto Public Health. And Dr. Brown, you may
Just
want
further
add.
to that, it does speak to how often we are meeting together. When we bring our data and we share that data with, just as Toronto Public Health does as well, it really provides those key intersection points that we're always happy to talk about. So it really does speak to that partnership piece. When we're bringing data to the table, and Toronto Public Health is as well, we're able to show measurable outcomes. We were able to talk today in our remarks to this group about some of the real increases in immunization rates that Clayton talked about, or the number of students that we're impacting from our dental screenings as a result. So we really feel strongly, we're educators, right? We want to see improvement. We want to see, so that's ways in which that partnership that we have, which is ongoing, is only strengthened by sharing as best we can.
Thank you. I'm going to jump topics now. The city declared IPV, intimate partner violence, as an epidemic. And I'm just wondering, with regards to healthy relationships, education, which I know happens in the schools, is there a component that's focused on IPV and gender-based violence prevention?
So a lot of the work that we're doing in the schools with school-age children, we recognize that students come to us every day from a variety of backgrounds, from a variety of realities. And, we're always trying to be thoughtful in our schools. What do students leave us every morning? What do they go home to every night? And that really is a big part of the work that we do. So the supports that we have in place in our schools, we really do rely on and appreciative of the support of our social worker teams who are intimately involved in the community, as well as our community partners that really know our students intimately and provide the supports that they need when it comes to understanding the realities that our students face. So a lot of that work is very intentional and very focused on student needs as we are connected. And Director Latouche will comment further.
I'll add that the curriculum that guides the work in every classroom speaks to the opportunities that you raise, Councillor. And so when we see evidence at the student's desk, then it tells us that we're having an impact. And so we would rely on what the curriculum has to say about what students are to be taught. And the curriculum is laid out on a grade by grade basis and is age appropriate for what students are to learn. And so there are expectations that speak to the developmental needs of students throughout the grades. I will also raise again our partnership with Safetio, or through Safetio, at which Toronto Public Health is at the table, Toronto Police is at the table, along with other partners. And so that provides us the opportunity to look at targeted interventions across a range of issues or factors. And certainly gender-based violence is one form of violence that would be considered in our ongoing work.
Thank you.
Okay, thank you. Those last questions, Councillor Chang. Any other speakers on the item or questions? I will ask one question or two.
Sorry, Chair, when you're done, I would request a second round. I just have a couple more questions.
We're very limited for time today, Councillor Chang. Unfortunately, I cannot.
It is a really important subject to me for students, and I just have two more questions.
I'll think about it.
Councillor Chang, you can send them to me and I'll ask them. I just think we have challenges with quorum in this committee now that one of our members.
Sure, I'll send them to you. Thank you.
Thank you. We have speakers on every item here today, and we also have a time crunch as well. My first question is around Vision Zero. Again, you may have heard about the province's initiative to remove automated speed cameras in our school zones. The City of Toronto said that we support those cameras because around safety issues around, again, schools. AMO has also stated that they want the cameras to remain. The chiefs of police have also mentioned they want the cameras to remain. What are the thoughts of the school boards around the Vision Zero goals that we have in the city?
Mr. Chair, so we are always, obviously, we were talking a lot of our comments today about making sure that we're creating safe and healthy environments for our students. We want to make sure that as a parent myself, as a parent of school-aged child, I want to make sure that my daughter leaves every morning safe and comes home every day safe. So the work that we do in our schools goes back to when I was a teacher, a principal, really thoughtful about what are the conditions in and around our schools that we can help to support to keeping students safe. So part of that work involves a very intentional focus on thoughtful about the way that our buses move, the way that our morning kiss and ride works, making sure that staff are out present with vests on that are helping to monitor and be as safe as possible, making sure that there's appropriate signage up in the area around our school zones, and really being vigilant in the work that we can do. What we have control over as a school board is making sure that we put the resources in place to make sure that we are supporting those habits that contribute to everywhere around our community, that people are driving safely, that there is a thoughtfulness around walking. Those are the things that we can control, and when we do that, we're vigilant about it. We want to make sure that our students are safe. So everything that we do in our schools, we really see, I talked a lot about learning in my presentation, but really, we recognize our key priority is making sure that when people entrust us with their children every day, they come to us safe and healthy and they go home safe and healthy. So with the resources that we have available, we put everything that we can in place to make sure that our schools are safe.
Thank you, and I certainly concur with everything that Dr. Brown has just stated. I will be explicit to say that I'm not about to wade into a political discussion, as I know that this is a hotly contested issue. But safety is our core priority, and regardless of what legislation is in place, our commitment to creating safe environments in and around our schools will remain, and we look forward to working with all of our partners to ensure that our students arrive safely, that they remain safe through the day, and that they get home safely, and that will always be our commitment. Thank you, Chair.
Okay, thank you. And to continue on the theme of safety, we know that since post-pandemic, in quotations, violence in our schools have increased. And one of the things that, as a former school board trustee, we talked about and focus on is making sure that there are caring adults in our schools to make sure that these kids are supported and seen and heard, and help them where they're at. What initiatives are you taking and continue to take to focus on safety in our schools, making sure that those who are most marginalized are also helped? I know when I was at the school board, there's a question coming. When I was at the school board, again, we looked at SROs in our schools, and I know that we no longer have them at the TDSB, but we do have them at the TDCDSB, Toronto Catholic School Board. Again, what steps are we doing are we taking to support students in our schools around safety?
Thank you, and through you, Chair. I'll share one example that might help to speak to the shared commitment of our partners, including with Toronto Public Health and the school boards jointly. In August this year, before the start of the school year, Dr. Brown and I were pleased to actually speak to about 800 school administrators that were part of the SAFETO symposium, where we addressed all matters related to safety, and a number of the items that were surfaced in this morning's presentation, looking at the way that the partners work together, looking at the common challenges and the opportunities to work together on those challenges, looking at the role of leadership in creating safe environments, looking at prevention strategies, intervention strategies, and postvention strategies, so that there is effective planning in place and there's clarity of roles when issues arise. So that's one very concrete action that I'll use as an example to illustrate the joint commitment and work that is being done across partnerships to ensure that our schools are safe. Dr. Brown?
I would give an example, Chair Moyes, of the beginning of the school year. We have an annual general meeting with all of our teams. And our big focus this year was actually kind of speaks to your question, in the recognition that what we have control over, how we making sure that we're creating spaces in which students feel safe and included. And you mentioned it in your question, and that idea that every student should feel like there's a safe and caring adult that in the building that they can connect with. So our challenge and our ongoing focus for our school leaders, our principals, our department heads, and our teachers is recognizing that they have the ability to be that person for our students, to make sure that that student knows that there's somebody in that building that loves them, that cares for them, that they can connect with. And part of that is really about creating that culture and that welcoming environment is really our overarching goal, to make sure that when students come to us, they know that they belong, that they're welcome, that they're loved, that they're part of this community, and that they have people in the building that care for them. And that is an intentional work that we do. We want to make sure that our principals are actively taking that on, actively encouraging the staff to making sure they're making those connections. To go back to a question I answered earlier, what do they leave every morning? What are they going home to every night? And that we really do believe that that contributes to environments in which students have that sense of safety, that sense of the environment is theirs, and there's a collective and shared responsibility. And that's work that we continue to commit to, and we're seeing results in our buildings.
Thank you. Councillor Bravo?
Thank you, Chair. A question that Councillor Cheng and I shared was about the report that was deliberated here at Public Health. It's on the provincial report about the numbers of youth who are reporting mental health challenges, ranges from good health in 2015, 72%, compared to now 48% good mental health. And there was another study that showed 65% of youth saying that their mental health had suffered, and some of it was very severe. Can you talk about the ways that the provincial government or health investments in general are addressing what is really a growing mental health crisis among youth in Ontario and in Canada?
It's important to think about mental health in a tiered manner, and think about it as a triangle. With the most people at the bottom of the triangle, that's tier 1. The next level would be tier 2, and the tier 1 would be the least amount of students. So we recognize that there is an approach when it comes to mental health that it's essential for some, good for all, but we recognize it's more intentional in specific strategies the further we go up the tier. So there is the school Mental Health Ontario that we partnership in education. I sit on the provincial leadership committee for School Mental Health Ontario. And a big focus of the work is at the tier 1 level, making sure that we are thoughtful about creating mentally healthy classrooms and mentally healthy schools. And that does actually go a little bit to the answer to Chair Moyse earlier about taking the responsibility that we have in the work that we can do as teachers, as principals, and that's at that tier 1 level. The recognition is that our scope of practice is education. Our scope of practice is making sure that we're helping students to learn. But within that scope of practice, we recognize that we have a responsibility to create the conditions in our schools at that tier 1 level that students have the best opportunity to feel safe and included and loved. And that's at tier 1 level. So that would be, Councillor Bravo, maybe 80% of our students we would be in that tier 1. And we recognize that when we're thoughtful and this is where mental health supports is at the forefront of our thinking, because we recognize that we're all responsible for it. It's not just something that we move off to counselors or to psychologists or social workers, that we have a responsibility at all levels, and then we take that on very seriously in the work that we do together. At the tier 2 level would be intervention where students, beyond that general sense of what are we doing to create mentally healthy and safe spaces, are those where we have to have some intervention directly, and that may be with the guidance counselors, maybe social workers that are in our schools to provide supports. We do have school psychologists that are helpful as well. And that is really a little bit more of a direct connection for our students that we facilitate. It can be done at school, and we're thoughtful about that as well. At the highest level, the tier 3 level, is really more about the clinical intervention, and that's where the partnerships come in. So it's our understanding and the recognition and looking at the signs and the needs of our students, working through each of those tiers. But when there are some students whose needs reside outside of what we can provide from an academic context, and that's when we're so appreciative of our partners with our clinicians throughout the system. So really think about school-based mental health as that 3-tiered system, recognizing that those of us that are the academics, we recognize and embrace our responsibility to create mentally healthy schools and mentally healthy classrooms. And we also have our supports that are clinicians that work within our system and our clinicians that work outside the system.
Thank you, Dr. Brown. And I'll just add, again, I absolutely concur with everything that Dr. Brown just said, that provincially there is a PPM, where presenters refer to a program policy memorandum, and that's a vehicle that the Ministry of Education uses to provide consistent direction to school boards across the province. And there is a PPM on mental health that gives direction to all school boards, and there are a number of requirements in the PPM that direct how we provide sort of form around those elements that Dr. Brown just spoke about. One of those requirements is for each school board to have a 3-year mental health strategy and a 1-year mental health plan. And that is certainly developed in consideration of partnerships as well. And there are certainly joint actions between our school boards and Toronto Public Health to support mental health. I'll also harken back to our core purpose. Dr. Brown talked about our core purpose is education, and we are educators. And so a key function of schools is that teaching and learning process. And throughout the curriculum, across the grades, there are expectations for teachers around mental health. And there are also some very specific modules that have been developed provincially that are implemented in key grades in our schools across the province. So those are some of the examples of where provincial direction is supporting the work that is happening locally across our schools. Thank you.
Just
Thank you very much.
one more question.
Sure. Go ahead. But,
Yeah, shared with Councillor
to
Chang.
the directors, though, quick responses, please.
Yeah.
Go ahead.
Just quick. How is the managing the use of screens and phones in schools taking place, and is it helping? We're just noting a lot of stress and stress on youth, especially girls, because of the connection to and algorithms, et cetera, related to phones.
Quick, it's going quite well. It's been in place for a year now, and we're into month 3 of our second year. And students respect, the teachers respect the idea that we need to be focused on the learning at hand. And there has not been a lot of situations in which conflict has arisen as a result. I think students actually appreciate it as well for the most part. So to keep it brief for Chair Moyse, it's going fairly well.
I concur.
Excellent. Seeing no further questions, thank you so much for coming in today and sharing your thoughts with us. It's very much appreciated, and you're welcome to come back anytime. Okay. We will move on to deputants, and we have many on this item. First up is Daniel Freiheit, online. 5 minutes, go ahead.
There we go. Thank you very much. And thank you for not abridging it to 3 minutes. I was worried when you guys were late for quorum earlier. I thought there was going to be no-shows due to the traffic. But catch me at the infrastructure committee, because I think traffic is also an interesting health issue. And it shows an interesting relationship between the mayor and there's something called the Global Covenant of Mayors that impacts the city that I don't think people are aware of. Just by way of a background to the new medical officer of health, my name is Daniel Freiheit. I operate a Twitter account called Lion Advocacy. I've been doing a lot of advocacy on X about vaccine mandates in regards to COVID. But the information and the intelligence I've learned from that experience has applied now to beyond COVID to some of the issues that the city is now experiencing with low vaccination rates, although they're increasing. With the 60,000 kids that apparently aren't staying up to date. The 60,000 kids that aren't up to date on their vaccines, I think is connected to a lot of distrust that I've been highlighting with public health over the past few years. This board in particular, the former medical officer of health, and I want to make sure the current medical officer of health, and I guess I'll direct my comments to the new medical officer of health, because I find when I speak to everybody, I speak to nobody. So I'll consider this a direct address through the chair, of course. Dr. Paul Offit, who is a former FDA Vaccine Advisory Committee member, and Dr. Sanjay Gupta from CNN, he's the one that is the public-facing vaccine expert for CNN. Both have now acknowledged miscommunication failures with the COVID vaccine. Dr. Offit saying it was oversold. The vaccine was oversold in terms of efficacy. Which I consider basically misrepresentation, which induced people to get a vaccine that they probably didn't want to get. There was also a misrepresentation acknowledged with regards to a natural immunity from Dr. Sanjay Gupta. So with the backdrop of these kind of oversights with the COVID vaccine, I wanted to address the current policy of the medical officer of health to suspend children from school. Suspend kids from school for 20 days for not getting vaccinated with the 3. There's only 3, by the way. There's only 3 listed in the schedule, and those are, you could check them in the law. It's a meningococcal disease, pertussis, and varicella. Medical officer self sends out a direction to the principal to suspend kids for not getting those vaccines. And the language in the report that the medical officer of health is that the school is now trying to prioritize reducing the number of students that are suspended from school for non-compliance with the ISPA. This is not correct. This is not accurate, okay? There's no requirement to suspend kids for not getting vaccinated for these 3 diseases. And by the way, Quebec doesn't do this. An entire province with tens, hundreds, thousands of kids does not do this. The kids are doing fine. Here's what the problem with suspending kids from school does, okay? It creates a bit of a coercion, especially for the holdouts that really don't want to get vaccinated and may just do it because they're isolated, and then their free consent isn't really given. There's no requirement to suspend these kids, okay? It's permissive language in the legislation. Check it. It says the medical officer of health may ask the principal to suspend. This language and this dicey responsibility ends up passing the buck from the principal back to the Minister of Health, where everyone's saying that they have to suspend kids. They don't. It's not true. You don't have to suspend them. If they're contagious, maybe consider putting some restrictions on them coming to school. Suspending kids from school for not taking childhood vaccines is not a requirement. And suggesting that it is passes the buck of responsibility. Mr. Brown and Mr. Latouche raised use incredible language, which I fully support, which is that you want to create a loved and caring environment, an environment of belonging and trust. That was Mr. Brown that said that. Safe and accepting were the words I heard used from Mr. Latouche. Excellent words. Suspending kids from school, not cool. Don't do it just so they can take the medication. Also, another message for the minister, for the chief medical officer of health. You encourage people to get over the age of 6 months to get the flu and the COVID vaccine, not according to the National Advisory Committee on Immunization. They do not share your view on that. So why is there a departure? The language from NACI clearly says that the people may receive. It doesn't encourage anyone. And so what I've noticed during COVID, and I've gotten intelligence from X, is that people were passing the buck on responsibility. Oh, we're complying with public health requirements or advice from public health. Careful. They're getting those 2 vaccines at once. There's a dispute on that, whether that's the best way to do it. Encouraging people, let the physicians, let the family doctors encourage that. They probably won't. Thanks again. And follow me on Twitter, by the way, everyone, because I think
Thank you. You're at time. Thank you.
Stuff.
Any
That was
questions for
actually
the
before the
deputant?
finals, but thank you.
Seeing none, thank you. Next up is Joey Fox. Are you here? Online? Joey Fox?
Yes, I'm here.
Okay, 5 minutes, go ahead.
Thank you very much. So thank you for letting me speak. My name is Joseph Fox. I'm a professional engineer and the chair of the Indoor Air Quality Advisory Committee for the Ontario Society of Professional Engineers. When discussing how to improve the health and well-being of students in schools, as well as the other agenda item about RSV, indoor air quality plays an essential role. Although enforcement might be limited in some areas, Toronto Public Health's guidance carries significant weight as school boards follow guidance from local public health authorities. With this in mind, we believe there are 3 components that should be included in Toronto Public Health's guidance. The first is to reference Health Canada's guidance for indoor air quality professionals. Health Canada recently released this guidance, and it's a very valuable resource. TPH should recommend that school boards conform to this guidance. This guidance includes recommendations for carbon dioxide monitoring and highlights how pathogens can transmit through the air, the role that air cleaning, including ventilation and filtration, can play to mitigate the spread of respiratory diseases. The second thing we believe should be part of TPH's guidance is to follow ASHRAE 241, control of infectious aerosols. This is the engineering standard used to mitigate the spread of airborne diseases and is an essential tool to keep kids healthy. To effectively reduce the risk of transmission of respiratory diseases, ASHRAE 241 should be followed. The final thing we believe should be part of TPH's guidance is a proper program to monitor air pollutants and take action if pollutants are too high. In accordance with Health Canada's guidance, monitoring carbon dioxide is a very helpful tool to identify areas that are underventilated. Classrooms complying with current ventilation requirements should have average carbon dioxide levels below 1,000 parts per million. If classrooms are identified to have carbon dioxide levels consistently higher than 1,000 parts per million, actions should be taken to improve the ventilation. So to summarize briefly, the 3 things that TPH should recommend is complying with guidance from Health Canada for indoor air quality professionals, for all schools to comply with ASHRAE 241 control of infectious aerosols, and to monitor indoor air pollutants, especially carbon dioxide, to identify underventilated spaces. Thank you very much.
Thank you. Any questions for Deputant? Seeing none. Thank you. Wendy Green, online. Wendy? Wendy, unmute yourself. Okay,
Good morning. Hello.
Hello, 5 minutes. Go ahead.
Yes. Good morning, and thank you for this opportunity to speak to the issue of how schools can support the health and well-being of children and youth. My name is Wendy Green, and I'm a resident of Toronto and mother of 2 now adult children who attended Toronto public schools. First of all, I'd like to say that I am honored to follow Dr. Fox, who gave an excellent summary of what needs to be done. I'd like to add my voice as an ordinary citizen who's concerned about indoor air quality. A physically safety and a physically safe and healthy environment allows children to learn more effectively and successfully. Improving indoor air quality is key to achieving this. We have plentiful evidence that clean air is essential to brain health and that poor air filtration and ventilation can lead to serious illness. We need to prevent infection at the source, and one significant way to do so is by cleaning the air. This September, Health Canada published its guidance for indoor air quality professionals. I'd like to quote from the introduction. Indoor air quality is considered an important environmental determinant of health. A healthy indoor environment is one that contributes to productivity and comfort of occupants and protects their health and well-being. End quote. The guidance proposes 3 strategies: reducing or eliminating the sources of air contaminants, ventilating by replacing contaminated indoor air with filtered air from outside, and filtering the indoor air. Dr. Alan Haddrell, that's Haddrell, a Canadian aerosol scientist and aerobiologist based at the University of Bristol, has extensively researched air quality and makes similar recommendations. I recommend his excellent video entitled "Why Clean Air in Schools is Important," which is readily available online. The work of Dr. Haddrell and others is bearing fruit. Just 2 weeks ago, the Mayor of London, Sadiq Khan, announced a £2.7 million project to install air filtration units in London schools. The City of London did the research and is now acting. In 2025, we have many excellent air filtration options to choose from. There's abundant research that shows that when appropriate air filtration systems are chosen and properly deployed, taking into account the clean air delivery rate and air changes per hour, the level of both airborne pathogens such as RSV, measles, flu, and COVID-19, as well as particulate matter, drops drastically, and with it, the rate of illness amongst children, teachers, and other school staff. The cost of air filtration pales in comparison to the cost of illness. Investing in proper air filtration to improve indoor air quality is one of the best investments we can make in our schools. Like the City of London, Toronto must seize the opportunity and become a leader in ensuring that schools have the best indoor air quality possible. By implementing Health Canada's excellent recommendations, we can make huge progress towards creating truly healthy schools and ensuring a healthy future for our children. Thank you very much.
Thank you. Any questions for the deputant? Seeing none, thank you. Next up is Phil Dawes. Phil Dawes, are you here? Okay, 5 minutes. Go ahead.
Good morning, and thank you for this opportunity to speak. My name is Phil Dawes. I'm an independent consultant and former school district superintendent of business, now working at the intersection of public education, climate adaptation, and community schools. Please know that I applaud your work and all of the work of the health units across Ontario, particularly as it relates to support for public school districts and schools. And while I deeply appreciate the commitment Toronto Public Health is showing for ongoing collaboration with school districts, I'm concerned that the motion associated with agenda item HL 28.1 and the Toronto Healthy Schools strategy it sets in motion does not reference the health impacts of climate change. The Ontario Public Health Standards, through the Healthy Environments and Climate Change Guideline, expect public health units to conduct climate change health vulnerability assessments. Back in November 2023, with the report for action entitled Public Health Impacts of Climate Change in Toronto, the TPH board approved the development of a surveillance framework for climate change and health impacts that can inform population health planning and resilience efforts in the city. Furthermore, this 2023 report for action expressed the importance of TPH to, quote, demonstrate leadership and work in collaboration with partners to reestablish our commitment to climate change and health actions that reduce health inequities. The 2023 report for action set in motion TPH's version of a climate change health vulnerability assessment. While the term wasn't used explicitly, the intent was clear: to identify and monitor populations, settings, and systems most at risk from climate-related health impacts. I would suggest that public schools are particularly valuable assets in this context, given their dual role as infrastructure and service hubs and their centrality to community resilience. There is no reference to the public health impacts of climate change in the Toronto Healthy Schools strategy. I think this is a missed opportunity for TPH, school districts, schools, and our communities at large. The climate health surveillance framework under development can inform and strengthen the goals of the TPH health strategy, but it cannot fulfill them on its own. That's the role of the strategy itself. Climate-related disruptions such as extreme heat, wildfire smoke, and flooding are already affecting school operations. School districts and schools need to build the capacity to adapt. Public awareness is a significant gap to be addressed in advance of real action, but climate change must first be recognized as a public health issue. This is where the Toronto Healthy Schools strategy can come into play. Now is the time for TPH to engage with school districts, municipalities, community partners, parents, and students to raise awareness of climate change as a public health issue and a driver of system support. That is, in fact, the stated goal of the strategy itself, to foster synergies in relation to joint initiatives between partners and to advocate for and create healthy school environments that support the health and well-being of children and youth. Opening the dialogue now by framing climate change as a public health issue will help build momentum for coordinated community adaptation planning and also unlock the necessary provincial funding to support community schools. This isn't just about sustainability, it's about adaptation, helping school districts and schools to align with the real and inevitable localized impacts of climate change. I'm hereby requesting that the board strengthen this motion by explicitly aligning the Healthy Schools strategy with the previously approved report for action of November 2023, and by engaging dialogue with school districts and community partners to raise awareness of climate change as a public health issue. Thank you very much.
Thank you so much for your interpretation. Any questions? Seeing none. Thank you. Cassandra Chern. And after Cassandra is Kelly McIntosh. Okay, 5 minutes. Go ahead. Just turn your mic on. Okay, there you go.
Good morning, Chair and members of the board. My name is Cassandra Churm, and I've been a public health nurse with the City of Toronto at Toronto Public Health for 25 years, most of that time working in partnership with the Indigenous community living in Toronto. I'm here today to speak about the school health strategy for 2027 and how recruitment and retention of public health nurses may determine its success. When I speak of Indigenous families, I use a definition that includes all who share responsibility for raising healthy children: parents, extended kin, elders, knowledge carriers, community members, educators, and health professionals. Throughout my career, I've worked alongside Indigenous families to strengthen community health and well-being and help children get the strong start to school they deserve. Some highlights include conducting thousands of home visits, building trust one family at a time, receiving the Stand Up for Kids Award, supporting the creation of 2 Indigenous-built and led medical clinics with 2 developmental pediatricians on site, 2 secondments to Indigenous agencies to work on their own health projects they identified, advocating for a dedicated public health nurse to support Indigenous schools and being that public health nurse during the COVID-19 response, developing, supporting, and implementing dental, vaccine, and vision pathways for Indigenous community members to access the care they need, and this year providing 258 health-related workshops across 21 Indigenous agency locations. However, my greatest achievement has been serving as a trusted public health nurse for the community that has every reason to distrust us. My work at TPH focuses on supporting Indigenous children start school healthy and ready to learn. When children are well supported by healthy families and healthy communities, they thrive, and so do our schools, with better attendance, fewer outbreaks, and a stronger partnership with public health. My responsibilities continue to grow. This year alone, I've been asked to take on more, supporting additional Indigenous agency locations, training on breastfeeding protocols, and eventually I will take shifts in the breastfeeding clinic at Crossways. I've been approached to learn about entering vaccine data to help keep student vaccine records up to date and avoid school suspensions. All of this while the threat of the next public health emergency cannot be ignored. This year alone, we've received 2 requests to be redeployed to manage measles cases and 1 to vaccinate for Mpox. I take on more because that's what the community tells me they need and TPH asks me to do, but it comes at a cost. I want to mentor new nurses to do this work, but I can't. All of the PHN workloads are too heavy to take on more, and our positions often feel unstable. Building trust like I have developed takes years, even decades. It can't be rushed, squeezed between other duties, paused when staffing or priorities change, or simply assigning a new nurse and hoping for the best. I fear my decade-long connections will end with me. I say this because I'm planning on retiring in under 4 years. Not because I want to, but I simply can't afford to stay. I will retire and move to another health unit and make more money. A nurse with my experience and education earns $2 more an hour in Niagara region, $7 if I'm willing to go to Durham. I could travel east to Prince Edward County and make $3 more an hour with a much smaller and less complex population than Toronto. They have a reported ratio of 1 public health nurse to every 600 community members. Toronto has been my home for 51 years, and my work at TPH my passion, but the wage gap makes staying unsustainable. Toronto Public Health often thanks me for my dedication, and I am grateful. My managers and senior leadership team have always supported me and let me thrive in this times a difficult but fulfilling work. But as I often say, I can't eat applause, and praise doesn't pay my bills. So today I ask you to go beyond thanks. As you develop the Healthy School Strategy for 2027, please address the wage disparity between Toronto Public Health and its surrounding health units. Without fair wages, we won't be able to recruit or retain experienced nurses, and without a stable, trusted frontline, the Healthy School Strategy cannot succeed. Thank you for your time.
Thank you. Any questions for Deputy? Seeing none. Thank you for coming in today, sharing your thoughts.
Thank you.
Okay, Councilor Bravo or Peruzza, can you turn your camera on for a quorum? Kelly McIntosh. Kelly McIntosh.
Good morning.
Okay, 5 minutes, go ahead.
When we think about what students need to thrive, we often talk about qualified teachers, student nutrition programs, physically and emotionally safe spaces, and support for special needs learners. But they also need something more fundamental: clean, safe air to breathe. Every day, students and staff spend hours inside Toronto's schools, most built long before we understood how critical indoor air quality is to learning, health, and even climate resilience. Poor air is invisible, but its effects are real. It worsens asthma, fatigue, and causes difficulty concentrating. And it helps respiratory viruses like COVID, flu, and RSV, which travel through the air like smoke, spread more easily. Clean air keeps kids healthy, teachers in classrooms, and parents at work. With the undemocratic loss of elected school trustees, parents now have fewer ways to advocate for these improvements. That's why city leadership is so essential. Other cities are already showing the way. The Mayor of London recently invested millions of pounds to install air purifiers in every classroom, recognizing that effective operational machines, unlike the Austin air units currently gathering dust in many TDSB schools, are as vital to education as teachers or books. Here at home, Health Canada's new Guidance for Indoor Air Quality Professionals draws on the updated ASHRAE standards, which define best practices for healthy, energy-efficient buildings. Toronto should follow its federal counterparts' lead by making clean indoor air a central public health priority. Implementing these standards protects students and staff while also making our buildings more resilient to climate change, guarding against wildfire smoke and pollution, extreme heat, and supporting the city's net zero goals. I will continue to wear my respirator in public, but community health cannot be achieved on an individual level. Information empowers people to protect themselves and each other. Therefore, I ask the Board of Health and Toronto Public Health to take these 3 steps. 1, run an extensive publication campaign for students, families, and education staff about the harms of airborne toxins and infectious diseases, how to clean the air we breathe with easily available tools like ventilation and filtration, and the effectiveness of wearing high-quality, well-fitting masks. 2, advocate for citywide enforceable policies on what constitutes clean indoor air, which cover all schools and public indoor spaces, not just those where municipal employees work. 3, publish the carbon dioxide and particulate concentrations for schools and public indoor spaces so Torontonians can assess how clean the air is in each space. Educate, advocate, publish clean air standards and tools. This isn't a cost, it's an investment in healthier kids, better learning, and a resilient, more equitable city. Thank you.
Thank you very much. Any questions for the deputant? Seeing none. Gil Panasola, you here? Gil? Okay, unmute your mic. I see your presentation, but you're still muted.
Hello, can you hear me now?
Yeah, you're good. Go ahead.
The
5
presentation
minutes.
is fine?
Yes, you're good now. Yep.
5 minutes. Okay. Thank you. Well, first I want to welcome Dr. Michelle Morley, Toronto's new medical officer of health. Also, I want to thank everyone who collaborates to make our children's lives healthier and happier. And my focus is well-being, health, and happiness. I have worked in over 350 cities around the world, and much of it is about this. I'm also advising cities for better health. I'm also in the Institute of Urban Health, and I'm working things related to walkability and bikeability and parks and trees and health. And my conclusion is that it's not a technical issue or a financial issue, that this is doable. I think public health in many ways has to move from reactive to proactive. It's not just about emergencies or pandemics. We put billions and billions into healthcare, but that will never be enough. It doesn't matter if it's privatized or not. We need to be healthier, and have healthier lifestyles. And I mean, with health, both physical, mental, social, so the body, the mind, the relations, and we need healthy students. I think that good intentions are needed, but are not enough. We need living healthier to be the easy choice, I mean, this looks like Copenhagen, but actually it's Paris. All of a sudden, Paris started greening, turning pavement into green, and allowing every citizen to have a protected bike lane within 1 kilometer, and taking the streets that are full of cars, not because they were empty, into cycling, and all of a sudden we can see the results, how the quality of the air totally changed. So this can have effects. So cities, Toronto, urban health, in cities we have the healthiest people, but we also have the unhealthiest. And schools could be the heart of the neighborhoods. This is really powerful. I think that the schools should be much more than schools. When we talk about sustainability, it's about all existing infrastructure having multiple uses. Every neighborhood has a school. Well, every neighborhood can have its own community center. School should be the hub of the neighborhoods. The heart of the neighborhoods could be amazing, so that during school time we see the children, but also we can improve the green, as this one done by Evergreen and others. So during school time is for the children, and that's fantastic from 7 to 4. And that's really, really nice. But look what cities are doing. This is Philadelphia, New York, that have done hundreds of schools taking this pavement to this. Only if they are open to the community after 4 p.m. and weekends and holidays. Instead of parking for a few teachers, then it's playground for everybody. So all we really gotta do is share after 4 p.m. and on weekends and holidays, and also all the time during vacations. And we don't need to share the whole school. We need all of the outdoor areas and the gymnasium and the library and maybe 3 classrooms. And also programs. We gotta work on walking back to school. We wanna eliminate sugar drinks. We should not be allowed to sell sugar drinks in any public area, in the schools, in the parks, in the libraries, etc. You can bring it from home, but it should not be allowed to sell. And we shouldn't sell any junk food. Mexico just passed a law that no schools can sell junk food or have junk food available nationwide. We should have urban gardening at every school. So this could really be amazing. In the schools is where we should have the flower markets and also the farmers markets. We should have cooking classes for children and in the evening for parents. I mean, for example, we were talking about the quality of the air in front of the schools in Paris. They are doing school streets. No, Paris wasn't like that. This is in the last 3 years, they have done over 380 schools. In front of the schools, they close the street in front of the schools, no cars, and then they do the design and they do it. And if Paris can do it, Toronto can do it as well. I mean, London saw it and London adopted the same program, except that in Paris is for greening Paris, in London it's because they want quality of air. We, in the school, we could organize dancing
We
with
have a few
friends.
seconds left.
It could really be amazing. So we need to change. We need to change. There's not going to be Martians coming down to transform our schools into community centers. It's up to us. We should not be building one community center in Toronto. They are doing one near my house, and there are 3 schools within a kilometer. What do the community centers going to have? The same as the schools. I know change is hard because in change, most of the opposing people show up. So then we end up doing the same because same is easier.
Thank you so much.
So, okay, 30 seconds. Toronto Board of Health, be the change. We need to show up. Elected officials, staff, community. Let's focus on the benefits. Schools at the heart of the neighborhood is about health and wellness, but also culture, education, environment, community. Let's focus on doing things right, but finally, also more important on doing the right things, like safe streets. Let's stop talking about speed cameras. We will need 8,000.
Thank you. I gave you an extra minute. Thank you so
that's
much.
5 for 800 schools. That doesn't slow. What really slow is having humps, bumps every 80 meters.
Thank you very much.
I have a question of the deputy.
Okay, go ahead.
Thank you, Mr. Penalosa, for your deputation. I actually had a conversation this morning with city staff about exploring the possibility of bringing community center programming into a local school where we can't build a community center. And one of the challenges that was brought up is the extreme cost that it can create, that school space is actually not that affordable or accessible in our city. Do you have any suggestions of how the city can overcome this type of challenge?
Mr. Gill, I think you're on mute.
Okay, now can you hear me?
Yeah, we can hear you. Go ahead.
Okay, I was saying that I really like Councilor Chen because she's always looking at ways how can we do better. And this is not a cost issue. Imagine how much does it cost to build a community center. With the money that we invest in building community centers, we could do the small adjustments that we need in schools to allow 3 classrooms and the gymnasium and the library to be open in the evening, Saturdays and Sundays. We should not be doing any more community centers. That's not sustainable. Sustainability is using the existing infrastructure in multiple ways. So it's not about money. You know, Nelson Mandela said, they always say it's impossible until it is done. I mean, why don't we do it? Why don't we do programs? Imagine that the Board of Health decided that for health, we need programs against loneliness, for physical activity, and so on. Imagine that in your ward, Councilor Chen, we could do 100 activities, 100. In each ward, actually, we got 25 wards. We could do 100 activities in each one, so it's 2,500 activities. The city cannot do it, so let's have citizens do it. Let's give $2,000 to each citizen that they want to organize activity. Dance, walking to school, walking the trails, any activity in group. So it's 2,500 activities times
So,
2,000,
sorry, I'm just going
25
to
million.
interrupt you, Mr. Penosa. So, are you suggesting that the city should absorb those costs, or have you also joined the advocacy of the Spaces Coalition that I know is advocating that the province make school space more affordable for community programming?
We need to make the school place available and affordable. We should only be charged for the marginal cost. So when we want to use the arena in a school, the school board should not have to pay $400. The only marginal cost is the guy in the Samboni. The same way, when the city is going to use the gymnasium, the only marginal cost is the janitor that is going to clean it up after. So instead of $400, let's make it $20 an hour.
So that kind of decision would have to come from the province in order to make that affordable. And I hope you consider joining the Spaces Coalition to have a strong voice of advocacy to make that possible. Thank you for making your deputation today.
I would love to support the city or any of the Board of Education in any way that anybody wants. And we have a mayor that has excellent relations with the province. We saw it in many cases, so let's make it happen. Also, she was a school trustee. The head of this committee also was a school trustee. So, I mean, this is a time that we need to do things better.
Thank you so much. Have a good afternoon. Next up is Tom Schoborn. Schioborn. All right, 5 minutes, sir. Okay, go ahead.
I just tapped this?
Yep.
All right. Hi, my name is Tom Schoenborn. I'm a clinical therapist, advanced practice clinical therapist in the community pending my fee renewals. I do extensive medical research on a variety of areas. Right now I'm heavily focused on passive tuberculosis and epilepsy. And this has been a grueling problem for me to move through in the last little while, and I brought it today because my concern is that it has had the widespread impact that I'm finding in the community, and how this relates to the impact on the functioning of children in schools, and also just the wider community in general and service provision in general. I'm finding that when I look at the statistics on the spread of tuberculosis globally, we're looking at a massive spread of close to 2 billion people. And then the narrative is that it doesn't affect people when it's passive or latent. It doesn't affect people. But I was very sick with it, and that's what ultimately drew me into this research, and what led me to a horrifying experience in the community of finding a severe deficit happening. So what I found is that I don't believe that this is true. I believe that it has a gradual affect on people, and that how it has a gradual affect on people is at first it starts manifesting as ADHD, then it starts manifesting as sleep disorder, then it starts manifesting as intestinal problems, and then behavioral problems, and then headaches and seizures. And this was the pattern that I went through, and that for years it was the first few. And I believe that when as I dug deeper down into the data, that this is what I ultimately came to the conclusion of, that this may be an origin source of where people's attention problems are coming from, and an origin source of where people's sleep disorders are coming from, and that this may have a deep impact because what I'm finding is that the kind I had, it was not detectable with tests at all, and the community would not treat me for it unless I had a positive test. I did not receive treatment ever and went through horrifying experiences trying to receive treatment in the community for this problem. I have since done extensive advocacy with the research I have. I have an entire binder here and massive studies I've collected pertaining to the matter of how it should be being treated versus how it is in the community. And the concern is that we're not treating a subsection of men who have an undetectable form, and as a result, that is feeding the widespread flow of tuberculosis in the community. And this in turn trickles down to the education system and the security of the community at a biohazardous level. I was able to find treatment through doing deep levels of meta study, finding alternative medicine treatments that had a high rate of effective treatment. So I actually did find a treatment. It was artemisinin that had an 85% testing rate in initial studies of effective treatment. But my concern is that as a result of the passive spread globally, that the affect on the community has actually been severe and that we have no idea, which is to say, what it does is alarming to the body because as it spreads through your intestines, then it eventually passes the blood-brain barrier into the brain and is meningitis, right? So when it does that, it does damage to the brain. And when I do psychological testing on the community, what I'm finding is increased passivity, increased passing the buck, increased problem with following the narrative that I'm giving, and a sort of, what I call it is a zombie paradox, where I'm a community authority on the matter, but I don't have a community job that's directly in the community. So the people who are the authorities in the community on these matters, because they're preoccupied with a significant volume of work themselves already, they only take on things that they feel are emergent. But because this affects the brain in such a manner where it makes it harder to view deeper narrative, like the deeper narrative of the areas of the brain are damaged, and then also other areas of the brain are damaged as well, or affected as well, where you start having problems with higher processing. And also because damage, what happens with people who get damaged is because of the dysfunction, they become, it increases anger and increases violence, violent tendency as well. And so again, speaking to before, you said, well, you noticed with COVID, after COVID, that there was increased violence in the schools and students. I believe that this is the kind of problem that relates to that trend, which is that ultimately, when you're sick, your body gets damaged, and then when your body gets damaged,
5 seconds.
When your body gets damaged, it increases the levels of violence. And so what I'm trying to say to you here is I'd like to find a way to share this information with higher community, because I believe that because of our impairment, due to it, and the massive spread in the global community, that it is actually far more widespread than we are aware of, because it can't be detected, and it is damaging the brain at severe levels.
Okay, thank you. Thank you. Any questions for the deputant? Seeing none. Thank you so much.
I have one question.
You also we don't take questions from deputants, but I see you're also on the next item as well. So
yeah, I just wanted to ask if there's a good time I could communicate with the health.
Speak to staff offline.
Pardon?
You can speak to one of the staff offline.
Okay.
And Carrie? Online?
It's where we said that before, Senators.
Go ahead, 5 minutes. You're on mute.
Hello, can you hear me now?
Yes, we can. Go ahead.
Great, thank you so much. So good morning and thank you for this opportunity to speak. My name is Anne Keary. I'm a member of the Parent Climate Advocacy Group for Our Kids Toronto. I'm also the Ontario Regional Coordinator for Canadian Association of Physicians for the Environment, or CAPE. So I'd like to begin by saying that I'm so grateful to the board and Toronto Public Health for all the work it does with our school boards to improve and protect the health of our students. I was particularly pleased to read in the report that Toronto Public Health will be supporting the expansion of a universal school food program in the face of such high food insecurity across the city. This is really welcome. I'm here today, however, to urge the board to include plans to address an additional health challenge in the next Toronto Healthy Schools strategy, the health impacts of climate change. In her 2023 report to the board, the medical officer of health at the time, Dr. Eileen de Villa, wrote, "Climate change is not only an environmental problem, it is one of the most pressing health issues of the 21st century." As she noted, each of the last 4 decades in Toronto has been increasingly warmer than any decade that preceded it since 1850. And we are seeing the impacts with more extreme heat days, our skies polluted with wildfire smoke, growing rates of vector-borne disease, and extreme flood events. And among the most impacted are children and youth, particularly children and youth in low-income, racialized, and Indigenous communities. Their developing bodies make them particularly vulnerable. They also risk lifetime health problems as a result of exposures in their early years. So given their particular vulnerability, and given that we know that impacts will worsen as fossil fuel-driven climate change intensifies, it is imperative that the board take action and include plans for protecting students' health from climate change impacts in the next Toronto Healthy Schools strategy. The need for this was brought home to me earlier this year when I learned that the TDSB held its city final track and field meet on June 10th during a period of high wildfire smoke pollution. Wildfire smoke pollution has been identified as particularly dangerous because of its toxic mix of gases and fine particulate matter, and it can affect children's respiratory, cardiovascular, and neurological systems. It also exacerbates asthma, which is now the leading cause of school absenteeism and hospitalizations across Canada. Clearly, school boards need guidance on these challenges now. The board is already supporting plans for monitoring and understanding the health impacts of climate change across the city. By adding climate impacts to the Toronto Healthy Schools strategy, the board could strengthen this work by addressing the particular needs and vulnerabilities of youth. In the letter to the board from CAPE and also CELA, the Canadian Environmental Law Association, we presented a series of recommendations on issues that could be addressed and included in the strategy, such as collecting data to track climate-related impacts on students' mental and physical health, data to identify the climate-related harms students may be facing on school property, identifying the infrastructure improvements needed to protect students' health, including measures to mitigate extreme heat and measures to address air quality issues, both in the classrooms and outdoors. Supporting the development of education on climate-related health harms and strategies for addressing these harms by, for example, developing materials on the health impacts of extreme heat and air pollution, supporting the development of school community emergency plans in the event of extreme weather events, and addressing student climate anxiety, which across Canada now is reaching incredible heights. Approaching 80% of students are worried about the impacts of climate change in their lives. Lastly, as a goal of the Toronto Healthy Schools strategy is to, quote, collectively advocate for and create healthy school environments, we urge the Board of Health and the school boards to advocate to other levels of government to fund the implementation of the infrastructure improvements needed to protect students' health from worsening climate impacts. Simply put, as the climate crisis worsens, we cannot wait to address this. Our students' health depends on it. Thank you for your time.
Thank you. Any questions for Deputy? Seeing none, thank you. Lindsay?
Students in grades 7 to 12.
You're not on mute, Lily. Lindsay Kennetman?
I want a piece of this, but not the whole thing.
Go ahead, Lindsay.
Hi, can you hear me?
Yes, we
Perfect.
can.
Great. So I'm a resident of Ward 14 and a parent to 2 children in the TDSB, an organization that, from my personal experience, needs all the help it can get when it comes to keeping our kids healthy. So I'm pleased to read the recommendation for TPH to initiate the development of the 2027 Toronto Healthy Schools Strategy. However, after reviewing the documents attached to this agenda item, I see a glaring hole that, if not addressed, will mean that kids and educational staff will experience more illness, more absences, and potentially even a reduced quality of life. That hole is indoor air quality, or IAQ, which isn't specifically mentioned in any of these documents, despite students spending nearly 1,000 hours a year inside school buildings, breathing away air that impacts everything from physical and mental health to productivity to academic success. The current school health services document does have a promoting healthy indoor environment section, which would cover air quality. However, AIQ is never named. Perhaps this explains why the existing communication efforts around reducing the spread of respiratory infections that have been mentioned have been so inadequate and ineffective. Equally disappointing is the preventing infectious diseases section, which only mentions vaccination. Vaccines are essential, please keep pushing them. But a vaccine-only approach is not enough, particularly in light of a growing anti-vaccination movement. Schools need clear, direct, actionable information on how and why to improve indoor air quality in their buildings. This isn't some woo-woo or pseudoscience idea. There are thousands of peer-reviewed studies on AIQ and a growing body of guidance. This includes from Health Canada, which recently released a new report that, for example, contains guidelines on CO2 levels for indoor spaces, which, by the way, the City of Toronto already has in place for office workers. Wouldn't it be nice if our school children had access to the same air quality that all of you sitting inside City Hall are currently enjoying? TPH needs to review Health Canada's new report and incorporate guidance from it and other similar reports into the next edition of the Toronto Healthy School Strategy. Perhaps assessing AIQ and providing recommendations becomes a new service TPH can offer to schools. Doing so would help advance the strategic plan as well as build climate crisis resiliency, as AIQ greatly intersects with that crucial topic. But most importantly, including AIQ would keep kids healthy. The two most common chronic health conditions in children are directly tied to air quality. Around 900,000 Canadian children have asthma, which can be triggered by poor air quality. Asthma can also be initially caused by infections spread through the air, as well as through exposure to pollution, including the fine particulate matter found in wildfire smoke, which has been mentioned is increasing. Then there's long COVID, which according to JAMA Pediatrics is now the most common chronic health condition in American kids, potentially impacting nearly 6 million children. We don't have Canadian numbers because we don't track things like that. But we do know that when kids are reinfected with COVID, it doubles their chance at developing long COVID. And we know that most kids will catch COVID every 1 to 2 years, some more often. We also know that COVID is spread primarily through the air and can largely be prevented if we simply clean that air adequately. So let's tell schools that and more, and let them know that HVAC upgrades aren't the only way to improve air quality in classrooms. To put it bluntly, failing to highlight indoor air quality in the 2027 Toronto Healthy School Strategy would be to fail our students and condemn some of them to health problems that would have been prevented if only the right actions had been taken. Thank you for your time.
Thank you. Any questions with Deputy? Seeing none, thank you. Michelle Arts, Dr. Michelle Arts. Members, please turn your camera on for quorum purposes. Michelle Arts is a current school board trustee at TDSB, by the way. Michelle, go ahead.
Hi, can you hear me?
Yes, we can.
Excellent, thank you. So yes, my name is Michelle Arts. I am the elected public school trustee for Beaches East York, and I also come to you today as the former biosafety coordinator for the University of Toronto Scarborough campus, where we set best practices for work and health environments. So I want to.
Sorry, 1 second, Michelle. Sorry to interrupt.
Sure.
Can we also have members turn their cameras on, please, for quorum purposes? Otherwise, we cannot continue. Thank you. Go ahead, Michelle. My apologies.
No problem.
One more needs to turn the cameras on. I'm being directed by the clerks. My apologies. So if Councilor Peruzza or maybe Director Singh can turn the cameras on. Here we go. Okay, go ahead.
Perfect. So
You can start over. My apologies. Go ahead.
That's okay. So my name is Michelle Arts, and I am the elected school board trustee for Beaches East York. And I also come to you with a PhD in biomedical research and the former coordinator and director for biosafety at the University of Toronto Scarborough campus. And I want to thank the Board of Health and Toronto Public Health for always being a strong partner who supports Toronto schools to innovate and support students and staff with best practices for healthy schools. The Board of Health, Toronto Public Health, and Toronto boards have always gone above and beyond minimal approaches that are provided by other levels of government. And this student-centered approach has been a key to success in Toronto schools. So I want to specifically speak to the 2027 development of the 2027 Healthy Schools Strategy and the attachments that were provided. So attachment 1, especially around preventing infectious disease and promoting healthy indoor environments. I want to bring to your attention an awareness campaign called 19 Days. 19 Days is a campaign from outside Toronto, but it highlights the significant negative impact of school absences. 19 days is 1 full month of lost learning, 1 full month of school days, and this lost learning can significantly impact student outcomes. Student learning is also or is further negatively impacted by staff absences, where a teacher or education assistant is missing work because of illness. Staff absences disrupt learning with disproportionate impacts on students with disabilities. When students with disabilities don't have their caring support adults in schools with them, they dysregulate. So earlier there were questions about violence in schools. A lot of this post-pandemic violence in schools is small children. So we don't want students and staff to come to school sick. There's great vaccination programs and vaccination requirements. Toronto feeds children, which is amazing to keep them healthy. But one thing that's critically missing is protocols and infrastructure in our schools to promote healthy indoor air quality. Attachment 1 states that the Ministry of Education is responsible for the built environment and protocols in schools, but it's important to keep in mind that the ministry only sets the minimum requirements and minimum standards, and schools have the ability to do better than those minimums. Indeed, Toronto schools go above and beyond provincial minimums for lead in drinking water protocols, for COVID safety protocols, and for student nutrition, thanks to the City of Toronto. So these are just a few examples of what school boards do or have implemented with that support. And by having the city be committed to student health, rather than just minimum standards, we have a better environment for students in Toronto schools. Innovation in Ontario schools has always been at the level of the school board. The Ministry of Education simply doesn't innovate. They will adopt innovative practices after they are established. So new best practices come from local school boards, a great deal of them from the schools in Toronto. And that has become because of the collaborations that we have locally. So I want to encourage the Board of Health and Toronto Public Health in the development of the 2027 Healthy School Strategy to incorporate the new Health Canada indoor air quality standards into recommendations for Toronto schools. This guidance is critical in protecting students and staff health and therefore improving student outcomes. By incorporating Health Canada's indoor air quality standards, the Board of Health and TPH would support school boards to set their own innovative practices. Toronto school boards have amazing staff who are dedicated to improving student outcomes. They have amazing support from the city, and they need that support now in order to develop the protocols. Toronto Public Health setting these kinds of standard recommendations doesn't force school boards to spend money that they don't have. It doesn't force them into places, back them into a corner, or force them to do things that are outside their capability, but it does give them the empowerment or the power to act where they can. So they love to innovate. School boards love to innovate. They don't have their boards of trustees to help them do that right now. A lot of innovation at school boards is empowered by a board or board of trustees that can give them the best practices and the go ahead to do this. And so it is particularly important now under supervision in the current environment that other levels of government that have that partnership are able to provide the best practices, do the background work that will empower schools to be healthier places. I know that we can do this together, and I thank you for your attention.
Thank you, Trustee Arts. Any questions for Trustee Arts? Seeing none. Thank you for coming today. It's nice to see you. Dr. Louise Hittinger. Online. Louise Hittinger.
Hello, can you hear me?
Yes, we can. 5 minutes. Go ahead.
I'm a concerned parent of TDSB students, and I'm also a member of Clean Indoor Air Toronto. We're a group of concerned Toronto residents who are dedicated to improving indoor air quality in our built environments. On September 19th, Health Canada published a document called Guidance for Indoor Air Quality for Professionals, which states that diseases can spread via particles that remain suspended in the air and travel longer distances, that ventilation, filtration, and HEPA air purifiers are recommended as risk reduction measures. There's evidence that people exposed to carbon dioxide concentrations above 800 ppm report more mucous membrane and respiratory symptoms, and that CO2 monitoring can be used to indicate ventilation adequacy in occupied spaces. City of Toronto's Municipal Licensing and Standards has reviewed the Property Standards Bylaw and posted it on October 16th, and in it they state that the latest guidance from Health Canada, published in September 2025, affirms that regular building HVAC maintenance is a critical baseline standard for maintaining a healthy indoor environment. Given that this guidance was published over a month ago and that MLS is aware of this document, we're wondering why the Health Canada document wasn't incorporated into Toronto Public Health's plan to work with schools to improve the health and well-being of students. TPH's plan for working with schools makes only passing mention of reducing the spread of respiratory infections, but no specific plan of what this plan entails. Now, earlier this year, former TDSB Chair Nathan Shan advocated on our request for better information on how to prevent the spread of respiratory viruses. TPH provided that information, but they put it in a folder of old materials, and they didn't give specific instructions on how to share this information. And as a result, only a handful of schools shared this information, and that's thanks to the advocacy of parents in our group. The vast majority of schools that we know of never shared this information. There's also no mention of a plan to protect the school community from the health impacts of climate change, including extreme heat, wildfire smoke, and air pollution due to flooding and heavy rains. All of these events impact indoor air quality, especially when, as is in the case of Toronto, many of our public schools are in a state of disrepair, lack mechanical ventilation and air conditioning, and that means a lack of access to good indoor air quality. It's imperative that this plan includes providing information to the school community about how to protect their health from the effects of climate-related events. As a parent of TDSB students, I'd like to know if the plan to reduce spread of respiratory infections will incorporate Health Canada's IAQ guidance. Will it include information on how to protect against airborne transmission of diseases? And will this information be shared effectively so that the entire school community receives this information? I'd also like to know if TPH will provide information to schools on how to protect against the health impacts of climate change, including extreme heat and air pollution from wildfires or heavy rains. And I just want to say that, the COVID pandemic, it's combined with the climate crisis, it's shown us that there's many sectors of our society that are vulnerable to the effects of air pollution and airborne infectious diseases, and that especially includes our children. These are people who may be immune compromised, kids with asthma, chronic respiratory conditions, and other chronic illnesses, which are not readily apparent just by looking at a person. We see that indoor air quality is an accessibility and an equity issue. The City of Toronto has an indoor air quality policy for its offices, which protects its office employees, but this policy doesn't extend to all of Toronto's buildings, and that creates inequitable access. And this IAQ policy forms an invisible layer of protection that many remain unaware of. So we're hoping that the City of Toronto can take some positive steps towards protecting schools and protecting the health of students and staff within these schools by adding this information, this vital information, in the Healthy Schools Plan for 2027. Thank you.
Thank you very much. Any questions for the Deputant? Seeing none. Up next is Heather Pun. Online.
May I share my screen?
We can hear you. Go ahead.
Can I share my screen?
You have the ability to. Go ahead.
Sorry. Sorry. Great. As part of the Toronto Healthy School Strategy, the first goal is to strengthen the partnership between Toronto school boards and TPH to collectively advocate for and create healthy school environments that support the health and well-being of children and youth. Despite air being the largest volume of substances we put into our bodies, breathing thousands of liters daily, there is no consistent monitoring of air in our schools. Advocate means to publicly recommend or support. Based on the new Health Canada Ventilation Report, have you advocated to the Ministry of Education for indoor air quality guidelines for schools and daycares? If not, why not? The Ventilation Report recommends for airborne viruses such as COVID-19, masking, ventilation, air filtration, and HEPAs. What conversations have TPH had with TDSB about using ventilation to mitigate the risk of airborne viruses? Is TPH aware that despite, sorry, I'm just having trouble switching it. There we go. Is TPH aware that despite Ministry of Education requirements for HEPAs in TDSB classrooms, the current policy does not require them to be on, only present in the room? They are underpowered, and there is no written standards for their usage and no measurements unless a complaint is filed. Who is responsible for ensuring this equipment is being used, and are you advocating for their consistent use? On masking, why does public health not demonstrate their own guidelines when entering schools? My child had school vaccines last year, and most of the public health nurses were administering these vaccinations were unmasked despite your guidance for respirators in a crowded indoor space. What a missed opportunity to have 21,000 students see your nurses following public health guidance, normalizing masking instead of having to rely on the example of my 12-year-old. Given the long-term consequences of repeat COVID infections, including a 38% risk of long COVID by the third infection, and long COVID possibly surpassing asthma as the most common chronic health problem for US children, is TPH comfortable remaining silent on the long-term effects of repeat COVID infections in lockstep with sick kids, who I quote from April, while our public-facing resources may not yet reflect the full scope of emerging research, our clinical teams are closely monitoring developments in this space and contributing to the evolving understanding of pediatric post-COVID conditions. We continue to explore how best to reflect this in our educational materials in ways that are accurate, responsible, and helpful to families. There's still no update. 2 lines buried on your website is the extent of what TPH is doing to warn families of the dangers. Omission is a form of misinformation. In contrast, other health units of large cities are warning about long COVID. Here is New York City and another from Durham, North Carolina. Compare it to the long COVID information that Torontonians are getting. The last I can find is in April 2023, 920 days ago. And to date, despite asking if there's been no information from TPH to school communities, why not? A deadly disabling disease is allowed to spread freely in our schools as it is not a reportable disease by the CMOH. Has TPH asked why? I'm tired of asking these questions and having no one willing to take accountability, having the burden of public health put on us and our children as we desperately try to shield them from preventable harm. The ventilation report recommends what parents like myself have been saying for years. Please advocate with us and don't stay silent. Thank you.
Thank you so much. Any questions for the deputant? Seeing none. Thank you. Dr. Joe Vipont. Online. Mr. Vipont, Dr. Vipont.
Yeah, sorry, can you hear me now?
Yeah, we can.
Sorry about
5
that,
minutes,
just
go.
bouncing around trying to unmute. So thanks for giving me the opportunity to present. I'm an emergency physician in Calgary, Alberta, and I have a lot of connection with a lot of the people here because I care a lot about COVID and I care a lot about climate. I'm the past president of the Canadian Association of Physicians for the Environment, and I'm also the co-chair of the Canadian COVID Society. Today, I'm just really going to focus my efforts on COVID. And I just want to acknowledge and point out that there's been 7 to 8 people who really focused their comments on clean air in schools. And I want to acknowledge their anger, and I want to acknowledge the fact that they're overrepresented here. And I think that's because, honestly, when you look at these plans, you know, the 3 ones that are in front of us today, which is the school, public health in schools, public health in kindergartens and childcare, and also the RSV plan, that air quality is really significantly neglected. And I want to ask this group why that is. I'm going to go over a couple things that I think have been missed maybe in today's conversation, and I want to emphasize a couple of things as well. First of all, schools are a very unique space. You know, I've always heard that people say kids are just cesspools of viruses. I don't think that's the case. I think there's very little parts of society where 30 plus people are elbow to elbow for, you know, 6 to 8 hours a day. So that's a very unique situation. You know, none of us in our office spaces face that. And so it does require us to care more about air than we do in almost any other space. Second, I want to point out that there is some misinformation that's actually in some of the documents I've read today. I read in the RSV, and you're going to be going into this, that RSV, like influenza and the virus that causes COVID-19, RSV spreads through respiratory droplets. First of all, there's a ton of information that says influenza and COVID-19 are predominantly airborne spread, and there's significant information as well that RSV is at least partially transmitted through the air as well. The other thing that's missing in this conversation is measles, which I can't even believe is a topic of conversation today. I acknowledge that a lot of that is due to inadequate vaccination, but it sure doesn't help that we don't have clean air in our schools. And of course, any future pandemic is going to be transmitted through the air as well. So I do think it's great that you have a full section of today's conversation about RSV management in Toronto schools. But let's acknowledge that COVID is the one that's really impacting our kids right now. RSV is very dangerous for the elderly, very dangerous for the very young, but COVID is the one that's hospitalizing our school-aged children of the standard respiratory viruses that we see every year. If you look at the stats, it's quite clear that acute COVID is continuing to be a danger even in the last year. We don't know what the future holds. We don't know what future variants hold, and we need to prepare for that. And of course, we've just started to have some people talk about long COVID. You know, this is a disabling illness. It is real in kids. Even if we take the smallest prevalence that's acknowledged, which is 1.3% of kids, that means that around 3,000 kids in the Toronto District School Board will have long COVID, and that number is only going to go up as we allow these infections to go through. Finally, I want to acknowledge that this isn't just about the kids, that the Toronto school boards have a legal responsibility through their occupational health and safety legislation to protect the teachers and other staff that are in these schools. And if there is an airborne transmitted virus, they need to have a plan to deal with this. So, you know, we have kids that have 12 years of schooling. If they are going to have recurrent exposure to an endemic virus, how many infections are they going to have in a 12 years of school? The thing that parents find frustrating is they have no control over what happens in those schools. Responsibility of air quality lies solely on the Toronto school boards, and it costs money. And I understand that that's frustrating, but it is the reality that if we're going to protect our kids, we need to spend the money to give them good quality air. Thank you so much.
Thank you. Any questions for Deputant? Seeing none. And the last speaker here is Beth O'Reilly. You're not here? No? Okay. take it in-house. Questions of staff? Keep in mind we asked questions of the directors already. Any questions of staff? Go ahead, Director Jose.
Thank you all so much, and I want to thank our deputants for the time they took and the concerns they raised. So my first question is on the equity indicators for the strategy. So what indicators are going to guide what schools or neighborhoods are prioritized in the rollout?
Thank you for the question, through you, Mr. Chair. Toronto Public Health uses indices that are developed by the school board to help, that are based on income, racialized populations, a number of factors. We use those indices to prioritize which schools across the board receive more intensive service delivery. Together with our partners, we also share that information around specific programs and share data that we do have to try and focus around particular topic areas where we would provide more intensive programming that's specific to specific data sets. So for example, with vaccine coverage rates, we share that, we look at that data and we determine where we may provide more intensive services to raise awareness around the importance of vaccination or around how to enter information into some of the provincial systems. So there's a variety of different data sets that are used to guide our decision making.
Okay, thank you. I was listening to the deputants and they brought up a variety of issues. So I recall one of them mentioned neurodiversity. And I'm curious on if you're familiar with this term called trauma-informed education, right? And is that something that public health is looking at as it's developing this strategy?
To the chair, thank you for the question. So certainly our staff at Toronto Public Health have been undergoing trauma-informed practice training to inform the approaches that we're taking through our public health nurse and our school health nurse liaison programs. I can speak to what's happening on the education side. Unfortunately, our guests had to leave, but we could certainly follow up with directors of education at the 4 boards to hear more about the approaches that they're taking in terms of trauma-informed education and how that aligns with the approaches our nurses are taking.
But would you have any ideas on how that could, at least on the public health side, how that would inform the strategy?
So I think to your earlier question as well on this, with the hope for the strategy going forward, I think one is to continue the really positive relationship that we've had with the school boards to work on a number of issues and to really relook at the priorities that we would have going forward from 2027. So certainly the priorities from the 2022 to 2026 plan were informed at the time during the COVID pandemic, and that we have new and different issues that we need to relook at together and see through a collaborative process how we can inform that strategy and what would those key areas to collaborate on moving forward should be.
Okay, thank you. And then my final question is, for the co-design, how will the youth themselves be engaged, especially youth from marginalized communities?
So to the chair, I think we would absolutely like to be looking at ways that we can incorporate a diversity of perspectives to be informing the strategy. So I think, with the recommendation today to move forward on that approach, we would be looking at, a more wholesome school community perspective as to what it is that schools are bringing, as well as to what it is that we're interested as Toronto Public Health to bring forward to that strategy, including the student voice. Our school health liaison nurses do lead a number of peer groups in the schools that they are engaged with, and so they do have a lot of really everyday interactions with peer groups of students in schools to bring that perspective forward into the work. And I think would be a great place to tap into to inform that strategy as well.
All right, thank you. That's it for my questions. And yeah, I would love to be kept updated on the trauma-informed education from the directors.
Thank you. That was your last question. Just for members to be aware, we may lose quorum at 1 o'clock because 2 members have to leave, and I think another has to leave at 1:30. So we may not get through this agenda, but unless some miracle happens. Any other? Go ahead, Council. You have a question? Go ahead.
I do. Thank you, Mr. Chair. Through you to staff, realizing that the effort is about collaboration and working with the Toronto District School Board specifically, there are other boards as well, but the Toronto District School Board, there isn't a board. So who are you actually working with?
Thank you for the question. Through you, Mr. Chair. We regularly meet with the directors of education and their senior leadership team to discuss strategy and new and emerging issues that are occurring. At the staff level, we connect with key system partners. So around mental health, we would be meeting with their mental health leads to co-design and implement and evaluate different initiatives across the school board. And then, of course, our school liaison public health nurse and public health staff are working in the schools, connecting directly with the administrators, teachers, and other school support staff in those service areas.
Got you, and thank you very much for the answer. So the board's role and responsibility is to, I gather, to implement much of what the directors and others in collaboration with the work that you're doing to ensure that there is an overall buy-in. Would you agree?
We work to implement the Ontario Public Health Standards, the school-specific guideline, in partnership with the school boards, and collaborate with them to inform how that is delivered and implemented in the schools.
Right, I get that. Through Mr. Chair, I just wondered aloud, and perhaps and get your input, because there seems to be a deficiency with respect to the overall operation. And I recognize the importance of this, and I think that somewhat what the parents were alluding to, decisions such as, effective methods dealing with air purification and so on in the school board and through the schools, it becomes rather a political decision, which is beyond simply those of the directors and others and our staff and the collaboration and so on. I'm just wondering aloud whether or not there's a necessity in light of how school boards are operating now or the lack thereof, whether or not there's a necessity to maybe do a more formal approach, whether or not through the mayor, to the minister, to the premier and so on, to really set the agenda to ensure the work that we're actually doing is actually as effective as it needs to be.
That's a good question, Councillor Thompson. I can say to you that as a former school board trustee and during COVID, that was top of mind for everyone. And that's conversations we had with the ministry back then. I'm sure that we're still having today. I know that in the past, public health, as well as others, have actually said to the Ministry of Education specifically that we need to actually have air filtration, proper air in all the classrooms, not just in some of them. But there's no harm in reinforcing that stance again, as again many of the deputants have stipulated. That's something that that happens in other jurisdictions. Keeping in mind that some of the examples that was given, the 2 layers of government, 2 levels of government, not 3 as we have here in Canada. So again, it's the province that's responsible again for education and for such policies around clean air. And to your point again, like if you want to bring forth a motion, that's something that we can do. If not here, perhaps, but perhaps even at council as well.
Yeah, for sure. I think I'd like to work with you on that, Mr. Chair, because I think it's a lot more complicated than simply what's in front of us, because there's an agenda. Don't know what it is, but obviously our effective agenda on behalf of those who have spoken and to the children and to the students is to ensure that they have clean air that they're breathing and that there is a more collaborative approach to actually getting things done and addressing these issues, because obviously, as we're discussing it today, it seems it's an argument that we heard 5-10 years ago that continues to happen today, and we're still looking for solutions, and they're not there, and it seems to be more of a political solution than it is a staff and board related matter as such. But I'm happy to speak with you and address that as it comes to council. Thank you.
And again, it's not a Toronto issue only, it's a provincial issue. And so I've heard similar concerns across the province from other school boards as well. Any other questions? Councillor Chang, go ahead. You're on mute.
Thank you. Just one question through the chair. I note that the Safer Party curriculum focuses on preventing substance use related harms. And I'm wondering, do we have a goal of preventing substance use altogether? Do we ever say to kids, don't do drugs?
To the chair, we do have, I think both directors of education spoke to the levels of education that happen at different grades and is appropriate to that educational and grade level. So certainly in the younger grades, that more blanket statement around not doing drugs and the harms of those substances is a clearer and more direct message. And then as children progress through the curriculum, and this is school-based curriculum, so just to clarify that Toronto Public Health does not, specifically deliver the curriculum, although we may provide advice on it. As they progress older, it's around recognizing that students may be in difficult situations, and it's more about the resiliency and practice around saying no, how to manage difficult situations, how to manage that difficult interpersonal challenges that may come when they are faced with offers of different substances. So certainly that it progresses through the age groups to have different kinds of messagings that are appropriate to the scenarios and age and developmental stages of children.
So, am I hearing that there is still a message as they get older, that's just a bit more nuanced? So I know there's harm reduction provided, education provided, but also is there still like that message that, it's not good for your brain development, don't do drugs, and if you do drugs, here's how to do it safely. Is that what's happening?
To the chair, yes, and I'm happy for my colleagues, Director Joanne, to add to that. But yes, so certainly that kind of continued message around avoidance of drugs, the harms associated with different substances is still part of that curriculum. And then it just adds those nuanced layers. So, how to say no in different situations, how to understand, people's own resiliency, understanding, difficulties in themselves and different relationships, to be able to understand, when they might be thinking about using substances to ease mental health or other stressors. So I think that nuance of information progresses as they get older in age, and then layering on to those messages around the avoidance of drugs and saying no to drugs and what the issues are, that recognizing that some people as they progress may be faced with those opportunities. So now moving into how can they refuse, and that if they were going to be using it, how could they do that more safely?
Great, thank you. Those are my questions.
Okay, thank you. Seeing no other questions, speakers on the item? Okay, seeing none. I'm going to start off by saying thank you to staff for this wonderful presentation and all the work that's gone into it. And of course, thank you to the various boards who actually we partner with on a regular basis, who do really a lot of the heavy lifting. So it's much appreciated, and I'm happy that we're able to continue that partnership. I will... Councillor Chang, you have a motion?
Yes, I do.
Well, I haven't seen it, so I'm not quite sure what it is.
I've been working with staff on it, and we have copied your office But this is just to highlight and strengthen our commitment to mental health and especially the impacts of screen time, because it is something that was not explicitly mentioned in this report towards building a new strategy. And I think we know that it has a pervasive impact. So just wanted to highlight that, as well as including the consideration of prevention of intimate partner violence and gender-based violence. And lastly, just strengthening our commitment to collaborating on the data that we receive, including the school climate survey. And I just wanted to add that, you know, this is a really important collaboration, this strategy, this chapter that we're embarking on, and it has far-reaching impacts because what we invest in now, what we highlight now, actually builds the future of our city. These children grow into adults and become contributing members. Their health and well-being impacts so many things. And I often hear at council how much we need to do upstream investments, including on youth violence. And that investment really hits the pavement here at the school level. So I look forward to the unfolding of this strategy, how we put it together. And I have full confidence that the work that we do here is going to be very impactful on Toronto as a whole. Thank you.
Okay, thank you. Okay, let's, any questions to Councillor Chang on this item? It's pretty straightforward. Okay, put her item back on the screen. All those in favor? Opposed? Carried. Item as amended. All those in favor? Opposed? Carried. Thank you. And thank you to all the deputies who came in today. I'm going to move a new item that I have here. I circulated it earlier today to all the members. The item is understanding the impacts of Bill 60 on health and well-being in Toronto. It's around the provincial government's motion to limit people's leases when it comes to expiry. And again, that housing is the social determinants of health. And we are in a housing crisis in this city and this province, as we know.
Just flagging about an hour ago, the Toronto Star just put out an article saying the minister's walking it back.
I saw that they did withdraw it, but there is a paragraph in my motion here just to acknowledge that, but again, to be vigilant and just to state how important it is. And it's really for the medical office of health to work with other city divisions to make sure that housing remains a priority in our city.
I just have a quick question of the mover to help maybe clarify while the minister has said, Chair, that the tenure of leases wouldn't be touched at this time. There's a bunch of other pieces that have to do with, there's a few other elements. Is that what you're trying to address here? Is that there's other pieces in the legislation which could contribute to people losing their housing, and that's what we still have to work on?
That's correct, because the bill is still before the House, and even though they've removed that one provision, there are other aspects of it that is problematic as well. And this is why in the motion, the recommendations, I'm asking the MOH to work with Toronto Shelter Support Services, Housing Secretariat, and also assessing the health impacts of this. Okay, does that answer your question?
Yes, it's very clear that we still need this. Thank you, Chair.
Thank you. All those in favor of adding this new item? Opposed? Carried. So I'm going to ask that we actually not have any more presentations on any more items for the sake of time, and also to any deputants who choose not to withdraw and not to speak would be appreciated. And if they do want to speak, please, be succinct and perhaps try to use 2 minutes of your time, just so we can get through this agenda. Again, I think we'll lose quorum in the next 30 minutes or so. And so I really appreciate your cooperation on this. So the next item is HL 20.2, publication of Child Care Center infection control inspection results. We're going to, again, forego the presentation, but we do have 4 speakers on this item. Tom Sherburne. Are you here? Can you please come up and be succinct as possible? And after Tom is Dr. Louise Hittinger, then Heather Pun, and then Dr. Jove Vipont. So please be aware of your timing cue. Go ahead.
I won't take too much more time because you pretty much got my whole speech before, more or less. I just wanted to touch on, again, the pressing concern I have about the affect on the community. And specifically, one thing that I didn't speak on before was also that when I looked at community service provision and I went out to a variety of health organizations in the community, and I went to schools and I went to community services in the community as well. What I found was that I was finding this similar affect across all of the people who work in facilities, whether they were mental health facilities, schools, wherever, was that they were all doing their jobs, and they were all doing their jobs according to protocol, but the problem was that they wouldn't be able to deviate from protocol, and that this was the problem I was having. The problem I was having was at an empathy level, that the impact this had, that there was a general degradation of the empathy level across the entire system, and that generally speaking, if it didn't fall into protocol, that they would just direct me to the next location that might help me with the concern I have regarding the level of spread of this problem in the community healthcare, in the community health. So I won't take too much more time around that, but really, I guess the pressing concern I have is that what I'm trying to illustrate in the problem with the research that I've done is that the reason why we're seeing situations where people feel like the community doesn't care or the leadership doesn't care or whatever is because I believe that the passive impact of this, that as the passive impact of this rises, as it spreads and it rises and the density of tuberculosis rises in the passive level in the body, extrapulmonary tuberculosis, that it gradually affects the mind more and more, and then it makes people more and more have more and more cognitive dissonance, and then it causes a situation where they believe they're ethical people, but they only do things that are convenient to them. And it becomes that balancing act we all experience where we have only a certain amount of time, like right now. We only have a certain amount of time to care about things. And well, what happens is because the affect of this is so high, that the amount of time that we care about it, well, it diminishes because we don't have the energy. It makes us tired, it makes us have headaches, and so on and so forth. And so if we're speaking to specifically to the second topic, looking at when I went into schools as well, I have very little interest.
The item that you actually off topic a little bit, so
yeah,
I'm going to actually ask you to wrap it up.
Okay, yeah, and that's fine.
Thank you.
Well, I was trying to bring it back around to the topic, which was that what I found was that there was very little preoccupation with the notion that there could be disease spreading in the school that we aren't aware of. That the disease spreading in the school, when they're evaluating the conditions of schools or conditions of the community in whatever organization, they were very perceptive of disease that is available to our senses and that we can see and we can test for, but there is not at all a preoccupation of the disease that we can't, and that's what I'm addressing.
Okay, thank you.
Thank you. I'm just, who can I speak to afterwards? Is there someone I can speak to at the end?
There are many staff around here you can speak to. Someone will approach you.
Okay, thank you very much.
Dr. Louise Hittinger, are you here online?
Hello, can you hear me?
We can.
Okay.
Go ahead.
As stated before, I'm a member of Clean Indoor Air Toronto, and I'm speaking on behalf of many members in our network who are parents or caregivers of young children. I just want to say that we support the initiative to create a public dashboard with the results of public health inspections of childcare centers. However, we note that the proposed public dashboard will only include the results of IPAC inspections that include review of administrative health policies, observation of cleaning and disinfection practices, hand hygiene, and inspection of washroom and diapering areas. There's no mention of measures to improve indoor air quality that would both reduce the spread of airborne diseases and protect against the health impacts of climate change. And that includes smoke and other air pollution, extreme heat. Parents and caregivers on our network have faced difficulty in finding childcare facilities that have good indoor air quality. Without information on the IAQ status in a given space, people who wish to protect themselves from air pollution, extreme heat, and airborne diseases are reluctant to access a shared indoor space. Poor air quality and the lack of information regarding IAQ status of a given space are barriers to access to the city's services and facilities, including childcare centers. Without IAQ information on the proposed dashboard, it's possible that a childcare center may be doing everything correctly with regards to infection control, which focuses primarily on cleaning hands and surfaces, but the space may still lack adequate ventilation and air filtration, and it may lack air conditioning. A parent looking for a safe and healthy environment for their child would have no way of knowing. We believe that the omission of IAQ data and lack of information about ventilation, air filtration, and air conditioning could present a dangerously incomplete picture of the safety of the childcare space. Now, LMLS's review of the property standards bylaw references the Health Canada IAQ guidance and compliance with the Ontario Building Code, which relies on ASHRAE standard 62.1 with regards to ventilation. So we also want to state that in addition, the City of Toronto has an indoor air quality policy for its offices based on ASHRAE 62.1, which includes acceptable ranges for temperature, CO2, and relative humidity. This policy doesn't extend to other buildings. Is there any reason why the IAQ parameters in the city's policy cannot be included as guidance to childcare centers? We're also wondering, will TPH update the public dashboard to include IAQ data, including CO2 and fine particulate levels measured during the course of the day while the space is occupied? Is there access to working air conditioning? Is there compliance with Health Canada's IAQ guidance and the Ontario Building Code with regards to ASHRAE 62.1? Thank you.
Thank you. Up next is Heather Pun. Heather Pun, are you here?
Hi there. I'm competing by proxy for Sam Kaufman. I understand that this has been a long delayed initiative, but would like to urge the board to consider carefully whether the current context merits an adjustment to the inspection regime and the presentation of the results. The reason for the delay, of course, is the ongoing COVID-19 pandemic. One of the main lessons we've learned from the pandemic is that many viral illnesses, including COVID, but also common childhood illnesses like flu, RSV, measles, are spread primarily through the air. This prompts the question, does the infection control inspections make any attempt to assess the control of the transmission of airborne infections? And secondarily, is this assessment communicated in the planned publication results? I ask these questions with some trepidation, given TPH's traditional hesitancy about all things airborne. Partly due to this hesitancy, unfortunately, general public awareness of measures that can control airborne infections is low. Many studies have in fact shown that ventilation and air filtration can reduce the spread of airborne infections when they are implemented appropriately with respect to occupancy. And there are emerging standards such as ASHRAE 241 that provide targets to aim for and have an effect. If no attention is paid to these measures, the prospect of a childcare center passing inspections with flying colors despite woefully inadequate ventilation subject to constant flu, RSV, and COVID outbreaks is very real. The publication of these results would then be worse than misleading. They could actively harm children by steering parents in the wrong direction when choosing childcare centers. Frankly, childcare centers inspections present a huge disease prevention opportunity for TPH. They represent perhaps 100,000 children, 10,000 staff, as well as the children and staff's family. Childcare centers are often located in schools, raising the potential for positive spillover effects to the school population at large. There are TPH staff literally going into these spaces annually and spending hours on site. Here are some steps TPH inspectors could take to help control the transmission of airborne illness in childcare centers. Inspectors could measure ventilation using portable CO2 monitors. If a once annual inspection is deemed unreliable or unfair due to variable weather conditions, permanent CO2 monitors could be installed and readings could be collected and inspected systematically. Inspectors could advise staff and building operators on maximizing ventilation, such as opening doors and windows when possible, and ensure that mechanical ventilation is operating properly and at an appropriate capacity. Inspectors could advise on or inspect portable air cleaners to ensure they are functioning properly and appropriately sized for the space. Illness policies could be assessed and strengthened, including sick day enforcement for staff and training on the use of well-fitting, high-quality masks, N95s, not loose-fitting surgical, to protect staff and older children who can wear them to help control outbreaks. Cumulatively, these measures would have an impact on the broader health of our city, not just by their effect on childcare centers, but by their effect on general public awareness of the importance of infection control for airborne illness. To conclude, I ask the board direct TPH to ensure that airborne infection mitigation is part of the Child Care Center infection control inspection, and that the results of this part of the inspection are published separately from other results to help parents make safe choices for their children. Thank you.
Okay, thank you. Any questions, Deputant? Seeing none. I need a motion to extend. Director Chandrabalan, to complete the agenda. All those in favor? Opposed? Carried. Up next is Dr. Joe Vipont, online.
Actually, I'll defer my
And
comments. I'll just say the last two deputants spoke very well, and I support both of what they said. I'll speak on the third agenda item.
Okay, thank you. Any speakers on this item? Sorry, any questions from members? Seeing none. Any speakers? Seeing none. Director Chandrabalan, you may move this item. Okay, all those in favor? Opposed? Carried. Thank you. Okay, let's go to item 3, Toronto Public Health update on respiratory RSV prevention. We have 6 speakers on this item. Jody Smith, are you here? Okay. Please be succinct as you can.
Will do.
And then after Jody Smith is Gloria Nastos, then Mariko Ude, then Skylar Hill-Jackson, Heather Pun, and then Dr. Louis Hittinger. Okay, go ahead.
Okay, thanks. Great to see everyone here. My name is Jody Smith. I'm a registered nurse, and I'm a public health nurse with Toronto Public Health. I have the privilege of caring for some of our newest, youngest, most vulnerable families here in Toronto, and I've been doing that for the last 8 years as part of a high-risk home visiting program. I'm speaking to the RSV item because as part of my role, I support families who are considering immunization and help provide education about how we prevent illness and death using vaccines. I'm so excited about the pilot project offering RSV vaccines in breastfeeding clinics. And this is a very innovative and welcome program that will save lives. So I wholeheartedly support the recommendations in this report. And I know that these programs will be delivered by knowledgeable, professional, competent, capable, passionate health professionals who've dedicated their careers to upstream interventions. These are Toronto Public Health workers, my colleagues who carry out the recommendations and directions that come from this board. And since it's budget season, we need to talk about how we're going to pay for it. Toronto has the distinction of offering the lowest pay rate for experienced public health nurses anywhere in the Greater Toronto and Hamilton area. And there are similar concerns for categories like public health inspectors and registered dietitians. And this has some effects on staffing. I have 3 examples to share with you today. One is that I've had the honor of training 2 other nurses to come on board in my role, but both of them have left after training. Second example is a nurse colleague who interviewed and received an offer to come over to Toronto Public Health from SSHA, and she declined the role after she realized that her paycheck would get smaller when she moved over to public health. Number 3 is that you've already heard about sexual health clinics being shuttered. And with Healthy Babies, Healthy Children, we currently have wait lists in 2 out of our 6 program areas, which means that about 1/3 of the high-risk births, people with identified risks do not get offered a home visit right away. And I do stay up at night wondering if by not being able to do a visit right away, if I might risk, I might miss a family with an urgent or a critical need that could have been addressed if we had been able to see them sooner. I know all of you are here because you agree that your constituents deserve nothing less than good health and access to quality services. And this means a well-staffed public health unit that's equipped to intervene with the right people. I would like to ask the board to take action to address the wage gap between experienced public health professionals in Toronto and the rest of the Greater Toronto and Hamilton area. While we do always appreciate the compliments and the kudos we receive for our work, it doesn't keep the lights on. And so right now, we are simultaneously hearing, great job, and also hearing, not worth it on our pay stubs. So which one is it? In the context of RSV, taking action to increase public knowledge and build confidence in vaccines will save the lives of vulnerable Torontonians. To do this well, we need to retain experienced care providers by paying them fairly. All the brilliant ideas that come out of this board cannot succeed without the right people to carry them out. So, thank you.
Thank you very much. Any questions for Deputant? Seeing none. Gloria Nastos, online. Gloria? Gloria Nastos? Okay. Unmute yourself, please. You're unmuted. Go ahead, Gloria.
Hi, I'm Gloria Nastos, and I'm a healthcare and pharmaceutical researcher. And through the chair, I wanted to take issue with the medical officer of health, Dr. Murray. I have a question. Why is public health failing to provide the necessities of life to the homeless? Access to resources they require, a home. They have no access to wash their hands, no water, no, they don't shower. Their hygiene is hysteria. It's off the planet. I don't know if they've recognized this, why it's not being addressed. It could cause infectious diseases. I'm sorry, I'm just a little nervous. And why isn't there any intervention from public health to provide the necessities of life? It's looking like they've been assaulted, like it's the greatest marijuana, the decriminalization of marijuana has committed the offense of the greatest mental assault against humanity. It's all these drugs, they're not being used how they're supposed to be, how they're intended, and they have a purpose and a function. And it's these drugs, the marijuana, the decriminalization made it, they can use it at any time, the 24-hour dispensaries. And that's the result out there. It's so out of order and off the planet. Human life is valuable in any condition, and there's no help for these people. There's not enough there's not enough attention. I think that I want to mention about medical marijuana when that started. That's when the abuse started. If it was medical marijuana, they should have used that. The doctor, after prescribing medical marijuana, should have sent them to like a medical clinic to use it instead of our homes.
Okay, we're talking about RSV, and you're talking about something else. So can you please stay on topic, or are you?
I'm not talking about RSV. I was just talking about the homeless and
About the items we're talking on, it's item 28.3, Toronto Public Health update on RSV.
That's it.
So
you comments. Use other. You can't talk about other topics.
No.
Okay. Okay. I wasn't aware of that. I thought it was on all public health issues.
Nope. If you're finished on this item, any other thoughts on this item? No?
Well,
thank you for coming.
Thank you.
Okay, thank you for coming in today.
Okay.
Next up is Mariku Uday. Okay, please be succinct. Just turn your mic on. Okay.
Good afternoon. I'm here deputing today regarding Toronto Public Health's proposal to ask the Ontario government to establish and fund a permanent RSV prevention program that relies on monoclonal antibodies called Beyfortus by AstraZeneca Sanofi for infants and vaccines, Abrysvo by Pfizer for pregnant mothers at 32 to 36 weeks, and vaccines for older adults over 75 years of age, Arexvy and Abrysvo. Okay, my understanding is that RSV has been around for a long time and that nearly all of us are infected by 2 years of age, which gives us partial immunity. And I also understand that it can be fatal in rare occasions, but for the most part, most people get through it fine. Given that the risks of RSV are very low, any drug or vaccine to prevent RSV should be effective and very, very safe. However, I have found concerns with each of the proposed products, which I'd like to share today. First, the Arexvy and Abrysvo, which are vaccines for older adults. In 2023, the FDA approved these vaccines for 60 and over. But in 2024, this was changed to 75 and over. Do you know why? Well, actually, they found growing evidence of adverse events, including Guillain-Barré syndrome, 1 in 47,500. And surveillance data also revealed other side effects. So the CDC walked back on their recommendation from 60 to 75. And my friend asked me, "Oh, does that mean that it doesn't affect people over 75?" And the answer is no. It's just that the 75-year-olds, they're maybe more likely to get severe effects from RSV. So then you would then allow them to use this vaccine. But it doesn't take away the side effects. So the side effects still exist for that age group. So I wouldn't say that these vaccines are totally safe. Next, I'd like to talk about Abrysvo, which is for pregnant mothers. In the clinical trials, preterm births were higher in the vaccinated group, but they were not statistically significant. So this means they were higher, but it could have happened just by chance. And it might not be statistically significant. So in 2023, the FDA actually approved it anyway, but important to know, 4 members of the FDA voted against it. But anyways, the FDA approved it, but they said, okay, we have to keep an eye on this vaccine for preterm births. So they required post-market surveillance for preterm births. And they also said, let's not give it to all pregnant women, just pregnant women when they're at the 32 to 36 week mark. And the reason for that is preterm births, if they occur before the 32-week mark, they can lead to more morbidity and mortality. So that's why they thought it's safer to advise people to get it at the 32 to 36 week mark. So I just want people to be aware of these issues because in the advertising for the RSV, you see posters, you see people that look like they're very confident in the safety of the vaccine. But I really believe we should be giving informed consent to people, and that when we share about the RSV vaccine, we shouldn't be one-sided and say that, oh, RSV is very, very risky and that the vaccine is perfectly safe, because it isn't. There are risks that people are taking. With the older adults, there's the risk of Guillain-Barré syndrome, and with the pregnant women, there's the risk of preterm births. So I think we need to look into these more before we get enthusiastic about giving them to everyone. And at a minimum, people should be given informed consent. Thank you.
Okay, thank you. Any questions of the deputant? Seeing none. Skylar Jackson, sorry.
Skylar Hill Jackson.
Skylar Hill Jackson, my apologies. You have 5 minutes. Please try to be succinct.
May I have the overhead, please? Thank you. Are Toronto Board of Health members aware that a pregnant woman in Ontario is advised and encouraged by her healthcare provider to take 7 or more vaccines during pregnancy? These vaccines include the annual flu shot and the COVID-19 and RSV vaccines. Are board members aware that everything crosses the pregnant women's placenta and the blood-brain barrier of the unborn baby? I think everyone here is aware that pregnant women are advised not to drink alcohol or smoke during pregnancy because these cross the placenta and the blood-brain barrier and may damage the unborn baby's brain. Please help me understand why board members are not concerned about pregnant women being offered the RSV vaccine in weeks 32 to 36 of the pregnancy. Are board members aware of the ingredients in vaccines? Aluminum, antifreeze, formaldehyde, human blood, animal carcass gelatin, aborted human babies' DNA, 3 different antibiotics, liquid fertilizer, table salt, food additives, cane sugar, fungus yeast protein, human urine, and in the case of the flu vaccine, there is mercury. Health Canada assures Canadians that all these ingredients are safe for pregnancy, unborn babies, newborns, children, and adults. If one of these ingredients was in this apple, would board members eat this apple? The next question is, where are the safety studies proving the RSV vaccine is safe for pregnant women and babies, unborn babies? Are the new medical officer of health and board members aware that there are no placebo-controlled clinical trials confirming the safety of vaccinating a pregnant woman and her unborn baby? Are you aware there are no studies testing the safety of combining multiple vaccines on the same day or within short periods of time? This is so important, I am going to repeat myself. There are no safety studies testing the cumulative impact of these vaccines in pregnant women and their unborn babies. According to the Toronto Public Health website, quote, "It is safe and convenient to get an RSV immunization at the same time before or after a flu vaccine, a COVID-19 vaccine, and other routine vaccines." Really? Where are those safety studies for pregnant women and their unborn babies? Toronto Public Health is also offering RSV immunization to infants 8 months of age and under during RSV season, October to March. And where are those safety studies? No wonder there is vaccine hesitancy. Yes, there is a general loss of trust in pharmaceutical companies, governments, public health agencies, and healthcare providers. If you want that trust back, show us the safety studies. In February 2019, the FDA stated that, quote, "The U.S. government is recommending untested, unlicensed vaccines for pregnant women. Is Canada doing the same?" Are board members aware that Toronto is losing a large portion of the next generation of children to neurological, neurodevelopmental, behavioral, and learning disabilities, which are now chronic and lifelong? As a parent of 3 and a grandmother of 5, I am committed to evidence-based, deep research and education around vaccines. The members of my family strongly believe it is the responsibility of every parent to question everyone and everything and to do thorough research on both sides of the vaccine issue. Family members have thoughtfully weighed the benefits of natural immunity, the potential harm of natural childhood illnesses, and the purported benefits of each and every vaccine against the acknowledged risk of side effects and harm from each vaccine. The decision to vaccinate is one of the most important and most difficult decisions expecting couples and new parents will make. The members of my family know that the effects of vaccination are irreversible. One mistake early on in the brain and the body of any of my 5 grandchildren may be forever changed.
Thank you. Any questions for the deputant? Seeing none. Thank you. Next up is Louis Hiddinger. Go ahead for the 3rd time. Go ahead.
Hi there. I'm a member of Clean Indoor Air Toronto, and I just want to say that we're calling for a vaccine plus strategy. We noted that the RSV, the plan for reducing RSV infections focuses primarily on vaccinations. We support the vaccination program, but we would like to have this plan include a component of indoor air quality. So we're asking that TPH revise their plan to prevent RSV infections to incorporate the new Health Canada indoor air quality guidance. Thank you.
Thank you. Any questions for Deputy? Seeing none. And lastly is Joe Vipant from Alberta, I believe. Are you online?
Sure am. Thanks again for letting me speak. I represent the Canadian COVID Society, but I actually have a really strong interest in public health. I'll be succinct as you have requested. I'm just going to point out again, and I mentioned it earlier, that there is some misinformation in the presentation you're receiving from the Deputy Medical Officer of Health. It is quite clear that COVID and influenza have significant airborne transmission components, and that there are, at least the WHO explicitly states that there is airborne transmission or inhalation of RSV virus. If the reason why this is important, because if you get the mode of transportation wrong, you're going to get the prevention wrong. And you can imagine if, we were talking about a chlamydia prevention plan and only spoke of like hand holding as a transmission mode, you would get it wrong. And so it's really important that we get this kind of information right, especially from our respected medical officers of health. They need to be able to reference their assertions, and they need to be able to keep up on the current information. And I think this is really important in that you've had a number of anti-vaxxers present here today. They cannot adequately scientifically reference their information, and vaccines are a key component to what you're doing in preventing illness. So when it comes to your prevention plan, as Dr. Hittinger said, it's really focused on vaccines. Vaccines are important. I think we also need to talk more about hand washing. Hand washing is important, but we also need to be talking about cleaning the air. And this is a great opportunity in a presentation like this to talk about air quality. Finally, as I pointed out in my first presentation, RSV is an important illness. It's having a significant impact, as you can see in the slideshows, on our elder population as well as on our infants. But it is not the only infection like this, and I would like the Board of Health to commit to doing a similar prevention plan for COVID going forward. It's not going away, unfortunately. I wish we could all just wish it away, but it's not going to happen. And so I would like the board to commit to a similar prevention plan for COVID in future board meetings.
Okay, thank you. Any questions for our friend from Alberta? None. Thank you. Any questions from our directors? Questions for staff. Sorry. Seeing none. Oh, you have a question? Go ahead, Councillor Thompson.
Thank you, Mr. Chair. Through you to the Medical Officer of Health. Is the RSV vaccine safe?
To the chair, yes, we are following the advice of the National Advisory Committee on Immunizations that reviews the safety, effectiveness, and efficacy of vaccine products as part of their recommendations. And we are following the advice of that committee in terms of providing RSV to the pre-population, so older adults, an RSV prophylaxis program for infants, and RSV vaccine for pregnant individuals.
And so with respect to pregnant women or expecting mothers, is the vaccine safe?
We do offer the vaccine to pregnant individuals as per the National Advisory Committee on Immunizations guidance, which has reviewed the safety and effectiveness of that vaccine. Certainly the preference for some individuals is the infancy program, because who we're trying to protect is the infant, not the pregnant mom. So providing that at birth RSV prophylaxis is the preferred approach, and we know it's a very safe and effective prophylaxis for children. So getting it at birth is the recommended approach. We know that's not always available, and so we do have as that alternative vaccine available for pregnant individuals.
There was a list of ingredients that was stated by one of the presenters, many of them in their sort of state. One would be shocked. You heard the list, did you? And your comments, is it true, firstly?
I'm going to turn to my colleague, Dr. Vanita Dubé, who can maybe speak to the specific list for the RSV vaccine.
Thank you.
Through you, Mr. Chair. I think some of the notions of the ingredients like human urine are incorrect. Often in medicine, you may use the term urea, which is a medical term. It does not equate to human urea. So there is certainly transparency on the ingredients that are in products. I do note things, for example, like formaldehyde that may be noted is also readily on paper towels that people use to clean an apple, for example. So I think a deeper dive on what those ingredients are, how minuscule they are, and whether or not they have any effects is important for individuals to do. I also do want to note that every time a vaccine is given, it is given with informed consent. That's part of a professional practice.
So just rather selfish for my benefit, I'm due to have both these vaccine on Thursday or Wednesday. Should I be worried? That's what medical officer of health.
To the chair, we are recommending that COVID, assuming you're speaking about COVID and influenza vaccines?
Both, yeah.
Yes. So we have been providing those for many years now, and we have lots of experience in terms of giving both vaccines at the same time. And so you should feel confident to get your both of those vaccines at the same time as you're available.
Thank you very much. Thank you, Mr. Chair.
Thank you, Councillor Thompson. Any other questions of staff? Seeing none, any speakers on the item? Okay, I'll just say quickly that I too have full confidence in these vaccines, and I too am getting my vaccine in the next week or two as well. I'm going to have Councillor Thompson move this item. Can you move this item?
Oh, with great pleasure.
Yes. All those in
Thank
favor?
you.
Opposed? Carried. Thank you. I'm going to move the new business item. If you just put it on the screen. I spoke to it earlier, so I'm not going to do that again. All those in favor? Opposed? Carried. Yeah. I don't support it. You don't support it? Okay. Okay, Councillor Thompson's a negative. No, we don't need a recorded vote. We don't need a recorded vote, no? No. No, okay. It's not unanimous. The next item is HL 20.4, Toronto Public Health, preparation for FIFA World Cup 2026. We have two speakers on this item. Pia Berger, are you here? Online? Pia Berger?
Yes, hi, sorry.
Go ahead.
My camera isn't working.
We can
Good afternoon. Thank you for the opportunity to depute today. I would like to speak to some very serious omissions in TPH's preparation for the FIFA World Cup. Specifically in the report for action, there was not even a single mention of indoor air quality or IAQ in the entire report. This is really concerning given Health Canada's latest guidance on IAQ. Considering that this city will be hosting thousands of visitors, we need to prevent this from becoming a super spreader event. Where is the consideration of providing guidance to event organizers on best practices for ventilation and filtration? Again, in this report, unfortunately, there is zero mention of either. There are plans to do education campaigns on skin cancer as well as STIs. As part of these campaigns, sunscreen and condoms will be distributed. Both great initiatives. But did TPH forget that COVID and measles still exist? What are the plans, if any, for properly informing the public ahead of time about the risks that come with catching these airborne viruses? We have seen in the past how TPH has unfortunately done a very poor job of adequately informing the public of how to protect themselves from airborne illnesses. For example, in the lead up to the Taylor Swift concerts, there was a huge emphasis on fomite transmission. Yes, fomite transmission, with very few mentions of masking, ventilation, or filtration. With all due respect, this was a major fail in terms of public health comms and a missed opportunity to educate the public. Perhaps we can do better this time? Again, handing out sunscreen and condoms, great. But what are the plans to distribute N95 masks? The report mentions plans to develop a facility-based wastewater testing program and will promote messages aimed at reducing infection risk, but only if an increase in respiratory virus activity is detected. Of course, wastewater testing is important, but there's a major red flag here. TPH doesn't seem to understand that their job is to prevent the spread of disease, not just to react to it after it has already happened. When it comes to respiratory diseases, it would seem that TPH is just waiting for outbreaks to happen, but has failed to put together any real plans to prevent them from happening in the first place. But it's TPH's job to be proactive and to do preventative medicine. This reactive approach is insufficient and could very well mean a great deal of needless illness, disability, and even death. Finally, there are major accessibility concerns when it comes to how Torontonians will be able to enjoy FIFA events. Without knowing what the IAQ status of a venue is, these events remain inaccessible and high risk to people in the disabled community and to anyone who wants to avoid the health impacts associated with poor air quality. TPH's lack of action on IAQ is essentially entrenching barriers to accessibility for people such as my partner who's immunocompromised. Best practices means following the most up-to-date guidance from Health Canada on indoor air quality. So what is the plan for implementing that guidance for FIFA events? Thank you.
Thank you. Any questions for the Deputy? Seeing none. And last up is Talid Mamari. Are you here? Online? Talid?
Hello, can you hear me?
We can. Go ahead.
Sorry, one second. The button to turn on the camera is grayed out.
As long as we can hear you, we can hear you.
Okay, it's fine. Thank you very much. So thank you for giving me the time to speak today. I just wanted to touch on the points that Pia has already brought forward. I just like to reiterate the fact that Health Canada at a federal level has recognized airborne transmission as really a primary route for all respiratory infections, especially COVID-19. And Toronto's planning so far for major events has consistently failed to implement proper and evidence-based measures. And it doesn't make sense to have two-tier public health systems where federal advice is really ignored at a municipal level. Case in point as well being the Taylor Swift concert that was held last year. Anecdotally and off social media, I can tell of several cases of people confirming that they got COVID-19 at such attractions, which isn't unexpected. However, the risk of it and the frequency of it could have been much more properly mitigated. And essentially, to sum it up, what we are asking for is really explicit inclusion of indoor air quality standards and the planning for the FIFA 2026 World Cup, public communication strategy about air quality in event venues, possibly CO2 monitoring as well, and HEPA filtration in high-density spaces, and really to make it a model for all future events. Sorry, 1 minute. And I would also like to stress as well a few nuances about the World Cup that are even higher stakes than, for example, the Taylor Swift concert that was held last year. It's not just a few concerts over like 10, 15 days. It's matches and events over several weeks that involves quite possibly over 100,000 international visitors across the 3 cities where the World Cup will be held. And this involves really sustained exposure in multiple settings day after day. And there will be visitors at much, much more higher levels and with multiple high-risk venues where the venues themselves are even arguably more risky in terms of spread. And you would also need to factor in the transit infrastructure, Union, TTC, all the streetcars, all the fan zones, including bars and restaurants, and any hospitality venues. And ultimately, this carries over into the economic and the reputational risk at stake for Toronto. I just wanted to as well add there's a general sense of cost-benefit analysis to it. The World Cup will be generating plenty of economic activity for Toronto, but at the expense of significant outbreaks, it essentially lessens the net positive impact. One easy small thread saying, "Hey, I got COVID at this event, this game in Toronto," can send shambles throughout social media. Ultimately, mitigations are not as costly as they're made out to be. CO2 monitors, HEPA filters cost way less than the strain on healthcare system for thousands and tens of thousands of ill people as a result of improper planning and the lack of mitigation. Many businesses really do want guidance on where to start and how to start, but they don't know how to. And this is a great opportunity for Toronto Public Health, which is much closer on the ground than Health Canada, to really partner with the business community and not necessarily dictate to them the proper mitigation tactics. And ultimately, there is a sense of liability from the perspective of insurance. Insurance companies are already adjusting policies based on airborne disease risk. So despite the question, what is the city's liability? There is a documented outbreak at one of the official venues as well. And ultimately, there is as well the equity and accessibility lens. There are several thousands of immunocompromised people that live with immunocompromised family that are lifelong football fans, such as myself, and would love to attend the game in person, finally having the chance to be in the city where a World Cup is being held. But ultimately, these factors, given that they are not properly mitigated, especially at the ground level from Toronto Public Health, does raise a cause for concern and a reason for hesitancy from attending these events. Thank you.
Thank you. Any questions for the Deputant? Seeing none. Any questions for staff? Councillor Thompson, go ahead.
Thank you very much, Mr. Chair, through you to the Medical Officer of Health. Lots of work is being done in collaboration and coordination to prepare for FIFA 2026. Sorry, is that a yes? Yes, okay, great. Could you help us to understand a little bit more thoroughly the preparation and planning and so on that is specifically coming from your area as the Medical Officer of Health and the folks that you are responsible for coordinating to prepare for a safe and healthy event in 2026? And give us an overview. It's been stated, obviously, that there seems to be a lack of effort and lack of preparation, and it's perhaps hasn't been fully enunciated, but there is an appearance that there is no confidence in the work that's actually being done. Perhaps can you engage us and help us to understand the great depth and length that you and team are using to prepare and advance for a healthy, productive, prosperous game? I don't want you to address the economic development piece because that's not your space, but just on the health piece, I wonder if you can help us to have a better understanding as to what's being done and how it's being done, please. Thank you.
To the chair, thanks. Thank you for the question, Councillor. We're engaged with the FIFA Secretariat at multiple levels. We are a member of the Integrated Health and Medical Planning Table, which is the part of the FIFA planning group that's focused on preparing for the health and safety of people who are coming to the games and who are locally participating. And we're also working with both the provincial and now the federal levels of government to ensure we have good surveillance for the importation of possible communicable diseases, for instance, but we're also dealing with the mitigation of potential environmental concerns such as air quality and heat, which may occur during these games, so that we're prepared for a response should those occur during the times that the games are on. And we're also working across Toronto Public Health and other parts of the division to get ready for a distribution of condoms is one thing that we did during the Pan Am Games in 2015 very successfully. So we're planning that again during this high-profile gathering, and also working with our harm reduction programs, because we know that these events or mass gatherings, people do sometimes misuse substances, alcohol, and others, and so we're also preparing to respond to that.
Thank you very much for that. And in terms of measuring, is it the sewer water that's going to be measured? Can you help us to understand the proactive or the reactive benefits of that, please?
To the chair, so we're collaborating with researchers to try to do surveillance of wastewater at the actual sites of the event to see if we can detect the importation of communicable diseases that are not common here, so that we can respond to them if they do get tracked or imported into this area. So we're talking about wastewater surveillance at a micro level at the actual sites, as opposed to in the city sewer system.
I gather that. So what I want to, can I just unpack that a little bit further? So for example, the fan zone, where we have, which BMO Field will not be called BMO Field, but Toronto Stadium at the event itself. And I understand you want to obviously gather information and evidence from there. However, we know that there'll be lots of people coming to the city that won't necessarily be at the Toronto Stadium at that time, but will be in the fan zone. Are we concerned about those individuals as well, in terms of seeing what type of proactive or protractive elements are in the waste that's produced, or are we just simply concerned about the stadium itself? Because that definition would presume or suggest that the people coming are just going to be at the stadium, but we know the people coming are going to be vastly around the city. So I'm just curious as to how you are going to track that.
To the chair, we are going to include the stadium as an obvious location for surveillance, but we're also working with our research colleagues about other places that we may use this type of surveillance for. So we haven't yet identified all the sites yet, and so FanFest, but there may be others that we can engage with during this period of time. So we haven't gone that far yet to identify those locations, but we're certainly going to try to be as comprehensive as possible.
Sure, I appreciate that. So it's not just simply a static situation, more a dynamic process you can be working through. I just want to make sure it's clear that people understand that it's not just one location that you'll be looking and testing. So that as you work through the plan, you'll make those determinations in terms of the specific location, which actually feeds into the objective and the goal to do your testing.
Yes, to the chair, that is correct.
Okay, thank you, Mr. Chair.
Thank you. Seeing no other questions, any speakers on the item? I'm going to ask, sorry, you want to move it? Oh, you want to speak? Okay, go ahead.
Thank you, Mr. Chair. I just want to thank Public Health and the Medical Officer of Health and the team. I mean, they do a really good job. Really, and I think that people are really complimentary of them in the City of Toronto. In fact, I think that they do such a good job, you hardly hear much about what they actually do, which really speaks to the fact that it's being silent, it's being done, it's really effective work, and I want to commend all of the people involved and so on. I mean, they do what we take for granted, and it's just part of their duties and so on. For the FIFA games to be held here next year, I mean, we're all really excited. And I know that Ms. Sharon Ballenbach and team, and I'm part of that element of the team, the work that's actually being done, it's a considerable amount of work. And we know that it's a very costly, expensive process. And so every precaution and every effort is being taken and undertaken to ensure that it's going to be an amazing game. And the health piece and the food piece I thought was really important. That is going to be addressed by public health and all the associated elements and all the culinary aspect and so on. Because remember, this is a showcase opportunity for our city. This is something that's going to generate great amount of monies with limited amount of it coming to the City of Toronto itself and at great expenditure to ourselves and so on. So I think it's really, really important to have the conversation in a structural, healthy way that really speaks to the professionalism of the men and women who are working in this space. They're not actually working with blinders on. They're not working with earplugs in their ears. They're not working in the dark. They're working with professionalism. They're working with experience. And I think that this city has to understand that there's a level of confidence that is expected and should be expected from these professional men and women who do this great work. And so we often question their sort of commitment, and at least that's what comes to my ear in terms of some of the comments and the commentary and the emails that come in and so on. I'm not part of that group, quite frankly. Yes, I know that they're not infallible, but the fact of the matter is that we have no evidence at this particular point in time to suggest that they're being derelict in their duty, they're not being responsible and so on. In fact, we have ample evidence that suggests that they are, over and beyond what I would measure this group of people to any other health agencies globally in terms of recognizing how they have worked. And I go back the history of 22 years in this seat, in this environment as an elected official, going back to many medical officers of health and look at the great work that they've done. So I think that we need to ensure that we can celebrate them. Yeah, there'll be times when mistakes are made, but I don't think it's a perspective where we sort of draw a box and say, we can't trust them. I don't think that's the case at all. And while folks may have concerns about vaccines and may have concern about maybe how they do the work that they're talking about doing, that's fair. You can ask questions and you can perhaps offer insight and seek to clarify, but to be critical and to make this assertion that suggests that, and I know that it hasn't been stated, but the impression is that they're not kind of up to speed or up to the task. I think clearly they are up to the task. We have a healthy city, a city that's come through some very challenging health issues and so on. And what do we say at the end of it all? We say, thank you, Medical Officer of Health, or thank you, Toronto Public Health, for the great work that you've done. I was around with SARS when I first got elected in '03, and the fear and the scare and so on, it was public health that was providing us with direction and leadership, quite frankly, and I think we ought not to forget that. So as it is in a democratic society, as it is in a society like ours in Toronto, we can say whatever we want, we can be as critical as we want to be, but I think we need to be fair. Thank you.
Thank you, Councillor Thompson. Any other speakers? You want to move it? Okay. Moved by Councillor Thompson. All those in favor? Opposed? Carried. Thank you to TPH staff. Thank you to the clerk staff. Thank you to the board members who are here today and to all the deputants as well. And go Blue Jays, go. And that concludes our meeting for today. Have a good afternoon.